Hello, my dear friends. Hope you all are fine. Yes, I was just seeing your messages कि मेरे आने से पहले लोग क्या बात कर रहे हैं मेरे बारे में. Okay, चलो. Let's quickly join the session, बेटा. So I hope all of you are free and you are also finding it time to watch it live. नहीं, कोई शाइनेस वगैरह कुछ नहीं है बेटा, ऐसा कुछ बात नहीं है. So let us try to focus on the session. Yes, I will just allow some. Good evening, beta. Good evening, everyone. Good evening, everyone, beta. Good evening. Good evening to everyone. Yes, just allow some one more minute for the students who want to join, beta. Yes, अभी ठीक करके दे देंगे आपको, कोई प्रॉब्लम नहीं है. Yeah, so let us try to focus. Just allow us one more minute. Yes, Ankit, Mahesh, Adi, Dr. Maddy, Rajendra, sorry, Joydeep, सुरेश कुमार, हिमालयन, क्या बात है. हाँ, सच में बायोकेमिस्ट्री आ गया. बाप रे, बाप रे बाप. सच में बायोकेमिस्ट्री जैसे सब्जेक्ट वो भी इतना जल्दी नहीं. नहीं अभी. ओके, जस्ट अलाउ सम. थैंक यू सो मच बेटा फॉर दोस वार्म विशेस. लेट अस ट्राई टू allow some more time. राम राम बेटा, राम राम. Happy to see you guys as well. Yes, thank you beta, thank you so much, thank you so much. बाप रे, इतने सारे. अरे बाप रे. ओके, चलो चलो देखेंगे देखेंगे, जरूर जरूर. The efforts will be there from my side, and I believe all of you, my dear friends, over the last couple of months have put your best possible efforts in preparing for the FMG exam, beta, because it is not easy. Yes, definitely, beta, it is not that easy to, I mean, keep in the motion for the last couple of 5-6 months that you have been putting forward for preparing this. Hats off to you guys, hats off to you guys, beta. Hats off to everyone for hats off to everyone, beta. So I hope all of you have put your best possible efforts. Yes, so without wasting much time, beta, let us now try to focus on the session, and let us try to go with the 25 most important clinical type questions that might be asked from the subject of biochemistry as well. Beta, all of you know, as of, if you look at the previous year's question, many of the questions from biochemistry were clinically oriented, and we should also try to focus on the clinical type of questions that might be asked from this biochemistry. Yes, thank you so much for the warm wishes, beta. Yes, there was some issue with the light. I hope now it is got rectified. So let us try to go ahead with the session. Most awaited. Thank you so much, beta. थैंक यू सो मच. बाप रे. ओके, सो लेट अस फाइनली स्टार्ट बेटा. अब भी टिक करके दे देंगे, कोई प्रॉब्लम नहीं है. ओके, डन. फर्स्ट लेट अस ट्राई टू मूव टू द फर्स्ट क्वेश्चन ऑफ द डे बेटा जी. फर्स्ट क्वेश्चन ऑफ द डे, आराम से. डू नॉट जंप द गन, टेक योर टाइम, वी हैव टाइम, एंड ट्राई टू फोकस ऑन मेकिंग द एमसीक्यूज करेक्ट. आराम से पढ़िए, वी विल बी गिविंग यू टाइम so that there is no confusion beta. आराम से. Okay, so take your time and come up with the answers like how we do every time. You should be waiting for the answers beta. Okay, waiting for the question. Answers beta, answers. आप बोलोगे उसके बाद ही, if there is any mistake, we will be rectifying it. But I strongly believe that all of you will be telling the right answer beta. Yes, the answers have started pouring in. Yes, my dear friends, all of you are right. Only one student had made a mistake over here. Doesn't matter, but please try to focus beta. Yes, the right answer for this particular question, my dear friends, is the option number A. Yes beta ji, option number A is the answer for this, transketosis. Yes, whenever we talk about any patient who is suffering from vitamin B1 deficiency beta, very patients, Wernicke-Korsakoff syndrome patients, whenever we assess the vitamin B1 deficiency status, please try to understand that vitamin B1 is actually one of the important coenzyme for HMP shunt pathway, where we use that enzyme called as transketosis. This transketosis enzyme is actually important for the production of the pentose phosphates or the pentose sugar. So with that, there has been a question. Let us try to target the question one more time beta slowly. 45-year-old male, generalized weakness. My dear friends, whenever there is a word like this where they have mentioned about generalized weakness, the first thing that should strike in your mind that it might be a case of vitamin B1 ka deficiency beta. And indeed it is a case of B1 deficiency, but the patient might be suffering from beriberi. Let us try to complete the question. Recent complaints of loss of appetite. Yes, why loss of appetite, my dear friends, would be there? Complaints of loss of appetite. Also adds that been noticing swelling around the swelling bilateral ankles whenever he walks a mile. He also adds that he is a chronic alcoholic for the last 15 years. Daru, khamba, my dear friends, we all know most common cause of B1 deficiency in India. It is chronic alcoholism, and the second most common cause in India is the eating polished rice. Yes, all of you are also right. Yes, polished rice intake might be given as an history over here, but in this question we are able to see that they had mentioned about the alcoholism history over here, and he is not a regular one, that is a chronic alcoholic one beta for the 15 years. And my dear friends, the case has to be a vitamin deficiency, and in India direct assay of the vitamin B1 is yet not possible. That's why we try to take the help of a different approach where we go for measuring the RBC transcatolase activity. RBC transcatolase activity, my dear friends, is important over here. RBC pyruvate kinase is no longer measured beta. RBC lactate dehydrogenase nowadays also do not measure. Mainly the lactate dehydrogenase in your plasma is measured whenever we try to talk about any metabolic acidosis due to lactate. Wherever we have overproduction of lactate, for those we can also go for LDH measurement in our plasma. Take home point, one more additional thing extra over here that we need to remember beta G, that this RBC glutathione reductase activity, this is actually important for the assay of, my dear friends, vitamin B2 deficiency. Please remember, it is checked for, this is checked for vitamin, my dear friends, B2 deficiency. Yes, vitamin B2 deficiency glutathione reductase. Yes, all of you are right beta, हमें ये भी मिस नहीं करना है यहाँ पर. So please remember, if it is a question on B2 deficiency, like if they mention on angular stomatitis, cheilitis, cheilitis, glossitis, magenta red color tongue, if they talk about seborrheic dermatitis, and the earliest sign of vitamin B2 deficiency, my dear friends, it is actually the circumcorneal vascularization, where there will be proliferation of our bulbar conjunctival blood vessels. अगर हमारे bulbar conjunctival blood vessels के around there is engorgement of the capillaries, that is the first warning sign in case of vitamin B2 deficiency, my dear friends. And in assay of vitamin B2 you can also go on checking this parameter that is known as glutathione reductase. Try to understand. In this discussion we should also make one more point, that there be something called as RBC transaminase activity. RBC transaminase activity, my dear friends, it is actually checked for our vitamin B6 deficiency. विटामिन B6 deficiency बेटा. हमें यहाँ पर और एक चीज ऐड करना है बेटा, that please remember RBC transcatolase, it is for B1 deficiency, glutathione reductase B2 deficiency, RBC transaminase checked for B6 deficiency. Along with RBC transaminase, we can also check for one more parameter in the urine, that is called as beta xanthurenic acid. Xanthurenic aciduria, my dear friends, is actually one of the hallmark signs that we also get to see in case of B6 deficiency beta. Yes, right, my dear friends. So B1, B2, B6 deficiency. Try to remember beta, one of the old questions that I should also try to highlight over here. B9 deficiency, in older days they used to check by one more test that is called as Figulu excretion test. Figulu excretion test, और which is also called as histidine loading test. हम लोग ये दोनों चीज को भी देख लेंगे as we are talking about assays over here. So we should remember there is also something called as Figulu excretion test or histidine loading test. One of the old question that was asked earlier in your exam beta. So please do not miss this. And my dear friends, B12 deficiency, nowadays it is actually checked by a technique that is called as CLIA, chemiluminescent immunoassay. That is the gold standard technique, my dear friends, for understanding a patient who is suffering from B12 deficiency. And in case of all the B12 deficiency, you will get positive amount of something called as MMA, methyl malonic acidemia or methyl malonic aciduria. Methyl malonic acidemia or methyl malonic aciduria. Try to understand. This is a very, very important point. Try to remember this better. Yes, all of you are also putting up messages in the chat section. Let me also look at that and please try to understand. Yes, B6 toxicity leads to a dangerous condition called as peripheral sensory neuropathy. Yes, you are right, beta. B6 toxicity leads to peripheral sensory neuropathy. B6 deficiency leads to peripheral neuritis. Like B1 deficiency also lead to peripheral neuritis. ध्यान देने वाला बात यहां पर यह है बेटा, B1 deficiency, B6 deficiency can present with common sensation that is called as tingling sensation, and in both the cases it is known as better peripheral neuritis. But in case of B6 excess, it can also damage the nerve fibers, and then the condition is called as peripheral sensory neuropathy. Try to remember better. B6 deficiency cases are mainly seen in case of sideroblastic anemia, or also it is seen in case of tuberculosis patient treatment by one of the drug that is called as isoniazid. Isoniazid, my dear friends, is also important over there. So in this frame, my dear friends, that we are trying to focus over here, B9 deficiency, all of you know, there is something called as beta neural tube defect like spina bifida. And in case of B12 deficiency, we have talked about one severe condition where there is a nerve damage in our body that is called as SCD. SCD stands for subacute combined degeneration. SCD stands for subacute combined degeneration. So all those are disorders which are related to those. B1 deficiency, beriberi or Wernicke-Korsakoff syndrome. B2 deficiency names we have heard about. B6 deficiency we have talked about. B9 deficiency, you only said that there is something called as beta G, spina bifida and such. And B12 deficiency, all of you know, there is a condition that is called as beta SCD. SCD full form is subacute combined degeneration. In that disorder also, you should double check the level of by this positive parameter that is called as MMA, methyl malonyl CoA, that will be increased in our urine or increased in our blood. Aciduria or acidemia, both can be remembered. Whenever you look at blood reports in India, my dear friends, nowadays, along with the presence of methyl malonic acidemia, they are also mentioning about there is a raised level of something known as homocysteine. We have also talked about this dangerous parameter beta that is called as homocysteine, and homocysteine is also likely to be raised in all the patients who are suffering from B12 deficiency, like strict vegan diet patients, or in whom there is a gastrectomy done, or in the patients wherever we have glove stock type of paresthesia, or the patients might be suffering from malabsorption syndrome due to which B12 is not getting absorbed properly. Remember beta, whenever there is a deficiency of B12, you must see this that is called as methyl malonic acidemia or methyl malonic aciduria. In some patients, there will be also rise of this parameter that is called as homocysteine, which is a toxic substance, my dear friends. So try to remember beta, isko thoda sa hum log dekh lenge. And all of you know the measurable form of the B12 is known as cyanocobalamin. We have talked about 4 important forms from B12: adenosylcobalamin, hydroxycobalamin, methylcobalamin, and cyanocobalamin. Cyanocobalamin is the measurable form that we check by the technique called as CLIA. CLIA stands for chemiluminescent immunoassay. That is the best technique available in India as we speak for estimation of the vitamin B12 deficiency, right? So these are the important info that we have to remember over here beta with this question. Coming back to the question, some extra information I would like to share with all of you beta. Try to remember beta ji that erythrocyte matlab RBC, erythrocyte, that is RBC transcatalysis activity is the diagnostic test for assessing vitamin B1 deficiency. Basically, we try to check it either by whole blood or RBC. Basically, better answer is the RBC transcatalysis activity. Might checked by whole blood transcatalysis as well, but the better answer is better RBC wala. RBC का transcatalysis activity. Please remember the reference interval, the normal range I have mentioned over here beta. If you want to check it by the whole blood, it will be somewhere around 9 to 12 micromoles per hour per ml. But in case of RBCs, if you want to measure it in the RBC, then the activity should fall somewhere around 0.75 to 1.3 international unit per gram of hemoglobin. ध्यान देना है बेटा, whole blood में we have the different type of unit, but in case of RBC transcranial activity we are actually having a different type of unit over here beta. It is units, international units per gram of hemoglobin. So these values, I hope that they do not ask you. At least the information on RBC transcriptase should be enough for us to pass our FMG exam beta. Without wasting time, let us move to the next important question. Okay. Second question को देखते हैं. Questions are easy. I have not asked much of the bouncers. आराम से. You are beginning, we are beginning from the team missed with the series of 25 most important question, and this time we are doing the biochemistry session quite early. That's why this time I'm not putting much of bouncers. Don't worry about the bouncers. आराम से क्वेश्चन को देखिए and आंसर बोलिए. Yes. Yes, Ravi, homocysteine rise will be also possible in case of B9 deficiency as well. Yes, definitely you are right, beta. B9 and B12 both can rise the level of homocysteine, but methylmalonic acidemia will be seen only in case of B12 deficiency. Yes, my dear friends, the answers are pouring up. Yes, 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 yes. Right answer. Right answer. Most of you have chosen the answer as C. Only few of you have marked the answer as B. B सही जवाब नहीं है बेटा. Unfortunately, please try to remember the answer. Right answer to this question is glutamine. Yes, glutamine is the right answer over here बेटा. Right answer. सही जवाब. क्या बात है? Glutamine. Glutamine, option number C is the right answer. What is this question? What is this question? 62-year-old male suffering from CLD. What is CLD? What is CLD? Chronic liver disease. CLD. My dear friends, in India, if you want to survive as a doctor, if you want to survive as a clinician, you should be equipped with enough knowledge with at least 3 disorders that begins with the alphabet C. You should know what is CLD, chronic liver disease. You should know what is CKD, chronic kidney disease. And you should know how to handle the cases of stroke, that is CVA, cerebrovascular accidents. My dear friends, in India, these 3C are very much common. And if you guys are able to handle these 3 patients, that means you are actually through. Chronic liver disease very much common, CKD and CVA. CLD, my dear friends, suddenly presents with slurred speech, oh, blurred vision, and one episode of convulsions, my dear friends. Try to understand. Important point. Worried son adds that his father has been non-alcoholic and non-smoker. Oh, no history of alcoholism and no history of smoking. Please remember, still the patient is suffering from chronic liver disease. Workup revealed the enzymes to be on the higher side. ALT will be high. AST not that much high because all of us know ALT is more liver specific in origin. AST is more heart specific in origin. As it is a case of chronic liver disease, definitely AST also will rise up. But look at the rise of the ALT. ALT, my dear friends, is rising chappad phadke. There is too much rise of the ALT. This is pointing towards the disorder related to liver origin over here. ALP also to some extent is rising over here, better. And they have asked the level of the plasma ammonia. Plasma ammonia is found to be quite high, beta, almost 96 micromoles per liter. Normally, people say it is up to 30. The reference range is around 11 to 32 micromoles per liter, but in this patient there is a rise, significant rise beta. That's why this is also a case of hyperammonemia. And in patients of hyperammonemia, in our classes we have definitely heard multiple times beta that there is something called a slurring of speech, blurring of vision, comatose condition, and it might bring full stop to our life. There will be also tremor associated with this hyperammonemia patient. There is also tremor associated. Tremor has not been mentioned over here, but there is a strong suspicion because there is one episode of convulsion. Hyperammonemia, ammonia persistence in our brain can damage. And please remember, from the brain, whenever we want to take the ammonia to the liver, it will be always carried in the form of glutamine. Please remember, glutamine is actually the safe transport form that is used from brain plus most of the tissues. Brain plus most of the tissues, and alanine, my dear friends, is the from, it is coming from skeletal muscle. skeletal muscles whenever there is a rise of the level of ammonia, because whenever we are performing gym during heavy exercise, my dear friends, there will be also buildup of free ammonia inside the muscle fibers, which can damage the muscle fibers. That's the reason whenever you are performing strenuous or heavy exercise like going to the gym, you should also be able to send this excess ammonia in a safe form to the liver, and that form, my dear friends, is known as alanine. Yes, my dear friends, you are right that alanine is the form, please try to understand, from the muscles, and glutamine is the form from the brain. Yes, my dear friends, brain glutamine crosses blood brain barrier, it can damage, yes, hyperammonemia. Oxidative deamination reaction further will be done in our liver, where the glutamate, my dear friends, will be further released in the breakdown in the form of alpha ketoglutarate and ammonia. Ammonia will be handled by the urea cycle. Yes. Okay, so yes, thank you so much, beta, for the warm wishes. Type 2 hyperammonemia, Cahill cycle. Yes, my dear friends, important. Bah, kya baat hai, beta. Cahill cycle, yes. Along with alanine, we should also remember that it will further trigger one more cycle that is called as beta Cahill cycle. Yes, you are right. Cahill cycle, my dear friend, it is also known as glucose alanine cycle. केहिल साइकिल का दूसरा नाम होता है बेटा ग्लूकोज एलानिन साइकिल. Whenever this alanine is brought to the liver, alanine will first undergo transamination, where alanine will be converted to pyruvate. All of you know transamination is a reaction by which amino acid is converted to keto acid, and that keto acid pyruvate will not be allowed to go for acetyl CoA production for the Krebs cycle. Rather, the pyruvate will be now converted back to glucose by a pathway called as gluconeogenesis, and this newly made glucose in the liver will not go for glycolysis in the liver, rather it will be given to the muscle for glycolysis, because muscle requires continuous supply of ATP whenever you are hitting the gym. Whenever you are going for strenuous exercise, your muscle contraction has to be there for the time, and that's why this newly made glucose, rather than going for glycolysis in the liver, will be channelized to the skeletal muscle, where it will go for our glycolysis pathway and it will produce ATP in the skeletal muscle itself, beta. So yes, that part is actually called as Cahill cycle. This name also has been asked in your FMG exam, beta. Cahill cycle को एक बार देख लेना बेटा, important point. Yes, Cahill cycle, please remember, beta. Thank you so much. Yes, okay, thank you so much, beta. These are the points that we have to first remember over here, beta. Just a moment, just a moment, just a moment, just a moment. Yes, welcome back. Yes, so Cahill cycle, please remember, glycine has got not much role to be played whenever we are trying to address a patient of hyperammonemia over here, beta. Mainly we are trying to focus on this glutamine and the alanine. These are the two forms that we have to remember. One more take home point, one more thing I would like to write extra over here. Let's say on the exam day, examiner asks you some bouncers, and let's say glutamine, my dear friend, is not given, but still the question has been asked from brain. Man lo, on that exam day, in the options, alanine is there, but glutamine is not there. Remember, apart from glutamine, the second best answer we can remember, glutamine is the best answer from the brain. But the second best answer we can also remember one more amino acid that is called as beta asparagine. इसको थोड़ा सा हम लोग देख लेंगे बेटा. Please remember, there is also another amino acid called as asparagine. That is the amide form of the aspartic acid or aspartate. This is an extra information that we are writing during the YouTube live session, बेटा जी. इसको थोड़ा सा ध्यान देंगे हम लोग. ग्लूटामिन इज द बेस्ट आंसर फॉर ब्रेन. हम लोग ब्रेन के बारे में बात कर रहे हैं. ब्रेन में टॉक्सिक अमोनिया इज मेनली हैंडल्ड बाय ग्लूटामिन, बट द सेकेंड बेस्ट आंसर दैट वी मे रिमेंबर इज ऑल्सो कॉल्ड एज बेटा जी एस्पाराजिन. इसको थोड़ा सा ऐड कर लेंगे. Asparagine is actually one of the second best answer that might be possible for handling the ammonia transport. During the classes at MIST, we have heard multiple times this concept of ammonia transport. Let's do a quick recap, my dear friends. Most of the tissues, as well as including our brain cells, whenever there is production of excess ammonia, that excess ammonia, my dear friends, will be captured by glutamate to form one more safe amino acid that is called as glutamine. This glutamine production is done by an enzyme that is called as glutamine synthetase. Now it will travel via the blood, reaches the liver, and inside the liver we have another enzyme that can break this guy, that is known as glutaminase, by which whenever हम लोग पानी मार के तोड़ेंगे इस अमीनो एसिड को, whenever you are doing hydrolysis of glutamine by glutaminase, you will be able to release the same amino acid one more time, glutamate, and the byproduct that is getting released over here is beta NH4 plus. NH4 plus is nothing but ammonia, and this ammonia will be now further going into the urea cycle, right? This is the point that we have discussed beta during the classes. And from the skeletal muscle, during the heavy exercise, whenever we are releasing, there is release of the ammonia. That ammonia will be captured in the form of alanine. Alanine will come to the liver. In the liver, alanine will be transaminated. There will be a reaction called as transamination by the name of the enzyme called as ALT, which is also known by another name called as SGPT, by which it will be converted to pyruvate. And this pyruvate, my dear friends, will not be allowed to go for link reaction. This pyruvate does not go for link reaction to produce acetyl CoA. Rather, it is going through a pathway called as gluconeogenesis to produce glucose. And this glucose, rather than going for glycolysis in the liver, it will be going to go for our skeletal muscle, and under the skeletal muscle it will now go for something called as glycolysis. So glycolysis यहाँ पर होगा बेटा, and after which there will be production of pyruvate. Pyruvate again can get transaminated back to alanine. So in this particular one we are seeing there is a cyclization of between this guy glucose and alanine. This cycle, my dear friends, we have just now heard, it is called as Cahill cycle. Cahill cycle, please remember, Cahill cycle is for alanine. Cori cycle, my dear friends, it is for the lactate. Please remember, whenever we have ammonia handling, we require alanine from the muscle, but whenever we require lactate handling during severe exercise, that time we try to do about Cori cycle. Whenever we are performing heavy exercise, during heavy exercise in our muscle, we need to perform two more extra cycle. One is to handle ammonia, another one is to handle lactate. For ammonia, we require the Cahill cycle, and for lactate, we require the Cori cycle in our skeletal muscle beta. Yes, ammonia and well-fed state, this is the only example. Yes, this gluconeogenesis, my dear friends, we have discussed that this is possible in the well-fed state. क्या बात है, क्लास का बोला हुआ चीज याद है, क्या बात है, एग्जाम में एकदम फाड़ देंगे, पूरा फाड़ देंगे एग्जाम में एकदम. Yes, this gluconeogenesis is not seen in case of fasting starvation. Yes, my dear friends, you are right. You are right. This gluconeogenesis is not seen during fasting starvation, rather it is during well-fed state. Well-fed state. क्या बात है. Okay, great, great beta. Yes, please try to remember beta ji, important. Yes, wala pyruvate can go for transamination. Yes, this pyruvate, my dear friends, that is generated over here, this will also undergo transamination back to this guy that is known as alanine. This reaction is also transamination type of reaction. But ठीक है, इसको एक बार देख लीजिएगा. ammonia transport, important point. Okay, coming to the third question. Okay, we are understanding and going forward. Third question. Third question बेटा, ये चॉकलेट क्वेश्चन है एकदम, जैसे अमित सर बोलते हैं ना, चॉकलेट क्वेश्चन एकदम वो वाला क्वेश्चन है ये. आई होप ऑल ऑफ यू गेट दिस क्वेश्चंस इन द एग्जाम एंड यू कैन गेट 1 एक्स्ट्रा मार्क ऑन दैट एग्जाम डे बेटा. ये एकदम इजी क्वेश्चन, easy question, easy question, easy question. Answer. Okay, yes, no problem, my dear friends. क्या बात है. Yes, all of you are right. There will be no student who will be making a mistake in this. I believe all of you, beta, will be able to. Yes, my dear friends, please try to understand. Important. Yes, the answer is going to be for synovial fluid uric acid. Synovial fluid. Yes, synovial fluid uric acid beta. Basically, my dear friends, it is a case of acute attack of gout. It is a case of beta acute attack of gout beta. हम लोग ये चीज समझ सकते हैं, acute attack of gout. As you can see, let us try to go for the 40-year-old male. Yes, middle-aged elderly male. If you remember during the classes we have discussed acute attack of gout. It is mainly seen middle-aged elderly male. Middle-aged male at the age of 40. Middle-aged male. Yes, it is also matching with the normal time frame. Best friend's wedding, अरे बाप रे, दोस्त का कट रहा है, दोस्त का कट रहा है, तो मैं तो जाऊंगा ही जाऊंगा. प्लीज ट्राई टू अंडरस्टैंड. फ्रेंड्स वेडिंग, दोस्त का कटाई हो रहा है तो मैं तो जाऊंगा. लेट नाइट, ओके प्लीज रिमेंबर, गोज टू स्लीप next morning and wake up with experiencing pain, lower limb, and the sustained fall on the ground. There is a history of fall. Rush to the OPD. First such episode in long run. Pain now is localized in the right grade 2. Yes, my dear friends, right grade 2. Podagra. Podagra, most common site of deposition of the monosodium urate crystals. In case of acute attack of gout, it is the grade 2 first metatarsophryneal joint. It might be left or right. In this patient, it is the right grade 2. History taking full bottle of vodka. The laga ke daru, ekdam daru. Please remember, vodka last line. We have all discussed, my dear friends, one of the precipitating factor or the trigger for a patient of chronic attack of gout to move into acute attack of gout. He might not be having previous episodes of any hyperuricemia as well, but during full bottle, बाप रे बाप, पूरा bottle ले लिया अंदर, बाप रे बाप. I mean, full bottle of vodka last night, and that's the reason, my dear friends, this is a case of acute attack of gout. Better please remember strongly, this is an acute attack of gout. Acute attack of gout. Please remember, acute attack of gout में हम लोगों ने एक चीज पढ़ा था. If it is the case of gout, if it is an acute attack of gout, my dear friends, during this, please keep in mind, hello, please keep in mind, acute attack के time में, please remember, plasma or serum uric acid level will be normal or low than the reference range. Try to remember, beta. अगर गलती से भी आपने इस पेशेंट का ब्लड सैंपल ड्रॉ करके यूरिक एसिड को एस्टिमेट करने का कोशिश किया तो डायग्नोसिस गलत हो जाएगा. प्लीज रिमेंबर, इन केसेस ऑफ एक्यूट अटैक ऑफ गाउट, यूरिक एसिड क्रिस्टल्स आर नो लॉन्गर फाउंड inside the bloodstream because all of the uric acid, my dear friends, has been actually converted to monosodium urate crystals. And monosodium urate crystals, my dear friends, please remember, these guys are actually getting deposited in our smaller joints, mainly in the distal joints, and it is the first metatarsophryneal joint. First metatarsophryneal joint is the most common site, and that's the reason we all know we should go for diagnosis by a word that is known as arthrocentesis. Arthrocentesis is the word, beta. Arthrocentesis, yes, arthrocentesis, where we will aspirate this by the synovial fluid, and then we will go for this type of microscopic appearance. All of you know this is called as polarized microscopy. All of you know, beta, this is called as polarized microscopy. Important point to be noted. And under polarized microscopy, as my dear friends, I can see that you guys are putting a message that is something called as knee gout. Knee gout. Knee gout. And my dear friends, we also know ropo. This will be pseudo gout, beta. Ropo, my dear friends, will be pseudo gout. Knee gout, ropo, pseudo. Try to remember what is knee. Needle shaped elongation. Please remember, needle shape with negative elongation. Needle shape, negative elongation. Answer will go for gout. And ropo, rhombic with positive elongation. Rhombic shaped crystals with positive elongation. This will go for pseudo gout. Yes, during the classes, this is how गाना गाते हुए हम लोगों ने इस चीज को याद करके रखा है बेटा. नी gout, ropo pseudo. नी gout, ropo pseudo. Please try to remember beta. Ropo pseudo. Now, just want you to ask, what about the image based questions? My dear friends, what about the image based questions? Please tell me. Please tell me the first image and the second image. Are they same or different? थोड़ा सा खेलते हैं यहाँ पर, ध्यान देंगे बेटा. पहला इमेज दूसरा इमेज सेम है या नहीं है? Both these images are for gout or both these images are for pseudo gout? इमेज को देखो. By chance any of these two images has been asked in your FMG exam, what will be the diagnosis you will choose? Whether you will choose the diagnosis as gout or whether you will choose the diagnosis as pseudo gout? Yes, answer. First gout. Okay, first wala gout. What about second? Second, what about second, my dear friends? Yes, this is how they will try to capture you and they will try to confuse you. Beta, एक second ध्यान देना. Hello, hold on to your horses. Hold on to your horses. Try to understand, my dear friends. Actually, both of these images are same. Actually, both of these images are same. I have given you to confuse you. Yes, my dear friends, in WhatsApp messages are also coming that it is same. Yes, it is same image. Only thing, it is a case of severe case of gout where there are so many crystals under the smear. But here the number of crystals are less. Only difference is on the quantity. Why? Because try to understand beta. Here you are looking at these two different colors. I told you how to do this diagnosis. It is by looking at the color of the crystal. See, everywhere it is needle shape. There is no rhombus. अरे rhombus किस तरह दिखता है? Rhombic shape might be somewhere like this. This is the rhombus type. Rhombus type crystals will be seen. Rhombic shaped crystals are different. Here, no rhombic shaped crystals over here. My dear friends, actually the second image also is a case of an patient of gout. How do you assess beta? I told you, look at the orientation of the blue color. Blue color perpendicular, yellow color horizontal, gout. This is called as negative elongation. When blue looks perpendicular, yellow looks horizontal, it is negative elongation. What is positive elongation? Positive elongation, rhombic shaped crystals, they will be mainly oriented blue parallel, yellow perpendicular. But try to look over here in this image also, you are seeing the same thing, that blue is perpendicular, and my dear friends, yellow crystals are mainly horizontal in this cluster. So both of these images, my dear friends, are actually case of gout. ध्यान देना है बेटा. Confused. दोनों चीज हमने बात किया, बट दो इमेज दिया है, इसका मतलब ये नहीं कि दोनों अलग अलग इमेज है बेटा. These guys are actually same, needle shaped, my dear friends. Rhombic shaped crystals में crystal shape will be somewhere like this. It will be somewhere crystals like this, and please remember they will look blue when they are actually horizontal. They will look yellowish when they are perpendicular. That is the case of pseudo gout. वो अलग चीज है बेटा. Remember, in case of gout, we all know it is the crystals of the monosodium urate, and in case of pseudo gout, this is calcium pyrophosphate dihydrate crystals. This is called as also pyrophosphate arthropathy. Pseudo gout का दूसरा नाम है pyrophosphate arthropathy, and this pseudo gout is actually a differential diagnosis for chronic gout. It is a differential diagnosis for chronic gout, because in the patients of this pseudo gout over here, please remember the most common joint involvement, my dear friend, is actually the knee joint. यहाँ पर जो पेन होगा, that would be mainly associated in the knee joint बेटा. Knee joint, try to remember this. ओके, नी जॉइंट. अरे गोवा ट्रिप में बाद में आएंगे, थोड़ा सा पढ़ाई कर लो यार. पास करने के बाद पूरा पेल देख के पहले पास तो कर लो. पास करना आना है, पास होना है, उसके बाद गोवा क्या चांद तक पहुंच जाएंगे. कोई दिक्कत वाला बात नहीं है बेटा. आराम से भी पकड़ के बैठ जाओ और थोड़ा सा इसको देख लो बेटा. क्रॉनिक गाउट है differential diagnosis for pseudo gout. Most common is the knee joint and in the calcium pyrophosphate dihydrate crystals, where we try to remember the literature called as ropo pseudo knee gout. रोपो pseudo knee gout. अरे यार क्यों मेरा पोल खोल रहे हो यार? यूट्यूब सेशन चल रहा है, वो सब क्लास बाद में क्लास के अंदर कर लेंगे. यहाँ पर क्वेश्चन को ध्यान में दो यार. यार तुम लोगों को बुलाना भी मतलब खुद ही के पैर पे सर पे कुड़ाली मार लेने जैसा बात हो गया. ये क्या है यार? ओ माय गॉड. ओके, बाप रे बाप, ये क्या है? ये सब देख लो भाई, क्या है? व्हाट इज दिस क्वेश्चन? अभी पकड़ के बैठ जाओ, खुद का, किसी और का नहीं रही. बायोकेमिस्ट्री पढ़ो, आंसर क्वेश्चन प्लीज. यस. दिस इज द रिपीट क्वेश्चन बेटा. बोथ ऑफ दिस इमेजेस हैज बीन आस्क्ड इन योर एफएमजी एग्जाम बेटा. एग्जैक्ट my dear friends, both of these images. Try to remember this point beta ji. This is the most common mineral deficiency. Over here we will try to look for, it is zinc deficiency beta. Zinc deficiency, my dear friends, all of you should remember, in case of this sort of images, we are mainly talking about that disorder that is called as acrodermatitis. Yes, acrodermatitis enteropathica. Acrodermatitis enteropathica. Remember, in case of zinc deficiency, they will definitely mention about something called as the diarrhea. बट यहाँ पर डायरिया के बारे में हम लोग जरूर आंसर करेंगे. And please remember this acrodermatitis, these are the locations, my dear friends, location that we are able to see in that images over the face, over the cheeks, as well as in the groin region, as well as around the genitalia. We can also see the zinc. Please remember these patients are also zinc deficiency also is reported to be having something called as delayed wound healing. Please remember better, delayed wound healing, my dear friends, is one of the other important word that we should also try to pay attention. Delayed wound healing. Please remember, decay, delayed wound healing, delayed wound healing, delayed wound healing, my dear friends. This particular word, most common cause, answer will go for vitamin C deficiency. Second best answer, zinc deficiency. Third best answer, my dear friends, B2 deficiency. Please remember, डिलेड वुंड हीलिंग वाला जो चीज है ये हम लोगों ने काफी बार डिस्कस किया है क्लास के अंदर. इफ विद दिस क्वेश्चन दे आल्सो ट्राई टू club up all those things words that we should not get confused. Vitamin C deficiency cases we will be having features like gum bleeding, petechial hemorrhages, pinpoint hemorrhages, and all those things. Also tooth decay and all. Zinc deficiency, there would be mention of diarrhea. B2 deficiency, there has to be a mention of angular stomatitis, but the most common sign is angular stomatitis that is often associated with almost all the cases of B2 deficiency, right? इसको एक बार देख लीजिए. Yes, my experience. Zinc deficiency, alopecia, B2 deficiency, diarrhea, all those things will be also common over here. But dermatitis, there in case of B2 deficiency, yes, we have talked about seborrheic dermatitis. Yes, seborrheic dermatitis, all those points. Now, quick recap on the zinc, my dear friends. Zinc is actually quite important over here, beta. We have a list of problems associated with the zinc. Zinc is a very important essential element, beta ji. Try to understand. We have many things. I will just quickly mention those. Poor memory on the concentration is one of the point, beta. Night vision, my dear friends, whenever people talk about night visions, we are mainly concerned with vitamin A deficiency, nyctalopia. But please remember, many patients of zinc deficiency, they are also having difficulty to drive at night because of poor night visions. There is also thinning and dull of hair. It might also lead to alopecia. There is also chance of dry mouth. Please remember, blood sugar levels are also important over here because in our classes at MIST we have talked about zinc is important for the 4S. What are the 4S for zinc? Hello. What are the 4S for zinc? क्यों ब्लड शुगर लेवल मेंटेन क्यों नहीं हो पा रहा है? Please try to understand 4S. What is the 4S? 4S. I want answers. What is 4S? 4S क्या क्या था? 4S क्या क्या था? 4S क्या क्या था? Zinc से raised blood sugar level. Why zinc deficiency is prone to cause type 2 diabetes mellitus nowadays? Zinc, my dear friends, answer 4S. Okay, let me hear. Please remember, this is actually important for synthesis, storage, stabilization, and secretion of insulin. Please remember, there is something called as 4S. Synthesis, storage, stabilization, and secretion of insulin are all controlled by zinc. That's the reason, my dear friends, in case of zinc deficiency, we are going to have raised blood sugar levels as well because zinc deficiency can lead to. Please remember, important point to understand. Somebody has said something regarding some other 4S. अरे बाप रे बाप, मजाक बंद करते हैं बेटा. Try to focus on understanding the synthesis, storage, stabilization, and secretion, which is also a question that has been asked in your exam, beta. Low thyroid function, बाप रे बाप. Low thyroid functions. Please remember, adrenal fatigue, diabetic complication. Yes, that's what I was talking about. Diabetic complications are quite more in these patients. Excess hunger, zinc deficiency, excess hunger. Please remember, that's why try to people eat more. One of the cause of polyphagia in case of diabetic patients, it is also zinc deficiency, better. Immune function. Please remember, ongoing diarrhea often is the most common associated one. My dear friends, out of this list, most common, my dear friends, if we have to choose one answer, the answer will go for better diarrhea. Most common will be diarrhea over here. There is also something called as brittle nail. Yes, we have also talked about this poor wound healing. Yes, delayed wound healing or poor wound healing. And please remember, in case of males, my dear friends, it is also leading to something related to erectile dysfunction as well. Swelling of the prostate gland causing the poor urine flow, and sometimes it can lead to also erectile dysfunction. And we also have creaky joints. Also, we are having creaky joints. So please remember, darling, hair, alopecia, diarrhea, as well as dermatitis type of things, and poor wound healing. These are the features that we have to remember. बेटा इसको थोड़ा सा ध्यान देंगे. Important point to be noted. Okay. मजाक का बात है. चलो ठीक है, जिंक डेफिशिएंसी को हम लोगों ने पूरी तरीके से पेल दिया. आगे बढ़ते हैं. ओके, क्वेश्चन नंबर 5. क्वेश्चन नंबर 5 हो 5. क्वेश्चन नंबर 5. क्वेश्चन नंबर 5. हाँ डॉक्टर सुरेश, ये तो बड़ा प्रॉब्लम. ओके, आंसर्स हैव स्टार्टेड कमिंग. ओके, ए यस माय डियर फ्रेंड्स, HGPRTS. यस, ऑल ऑफ यू आर राइट बेटा. आई डोंट वांट टू वेस्ट टाइम इन दिस क्वेश्चन बेटा. वी हैव डिस्कस्ड दिस ड्यूरिंग मल्टीपल टाइम्स. एग्रेसिव 10 ईयर ओल्ड, एग्रेसिव बिहेवियर, पुअर कंसंट्रेशन टू स्टडीज, कभी पढ़ना बैठना चाहता ही नहीं है, पेन इन द लोअर लिम्स एंड रिड्यूस्ड यूरिनरी आउटपुट, सेल्फ म्यूटिलेटिव बिहेवियर, खुद ही खुद का लेना बहुत ही महत्वपूर्ण काम होता है. प्लीज ट्राई टू अंडरस्टैंड माय डियर फ्रेंड्स हिस्ट्री ऑफ सेल्फ म्यूटिलेशन बिहेवियर स्टेटिंग दैट ऑफ म्यूटिलेट हिज फिंगर्स. अनफॉर्चुनेटली ऑल्दो वी आर लाफिंग, बट दिस चाइल्ड इज वेरी अनफॉर्चुनेट बेटा, because this child is going to suffer from some disorder that is called as LNS, Lesch-Nyhan syndrome. And in Lesch-Nyhan syndrome, my dear friends, we all know there is a complete deficiency of the HGPRTase enzyme. कंप्लीट डेफिशिएंसी बेटा, पूरा का पूरा एंजाइम चला गया. इट इज एक्चुअली अ लाइफ थ्रेटनिंग टाइप ऑफ डिसऑर्डर. प्लीज रिमेंबर HGPRTS. ट्राई टू रिमेंबर complete deficiency of the HGPRTS, that is known as this Lesch-Nyhan syndrome beta. There is also something called as beta partial deficiency. There is also something called as beta partial deficiency of this enzyme, that is called as Keeley-Sigmiller syndrome, KSA. Keeley-Sigmiller. No need to write the full form beta, that is a PG level question. Just for your knowledge, there is something called as partial deficiency of this HGPRTS, that is called as Keeley-Sigmiller syndrome, KSS. Keeley-Sigmiller syndrome, where basically we have other problems like chorioathetosis, which is not much seen in case of Lesch-Nyhan syndrome beta. There is one more disorder beta G, all of us know, there is something called as ADA. What about this ADA deficiency? ADA deficiency, my dear friends, adenosine deaminase. This deficiency, please start. Okay. First try to focus. ADA, adenosine deaminase deficiency. एडिनोस, अरे पढ़ लो यार. एडिनोसिन डियामाइनेज डेफिशिएंसी, एडा, ADA, adenosine deaminase. This is called was KID. Yes, KID, SCID, severe combined immunodeficiency. Please try to understand. Few minutes back we have talked about SCD. SCD, subacute combined degeneration due to nerve damage due to vitamin B12 deficiency. वो अलग disease था. This is called as severe combined immunodeficiency, where there is a joint loss of T lymphocyte, B lymphocytes, and the natural killer cells together, and due to which, my dear friends, in the whole world, first successful gene therapy was also done. First successful gene therapy. Please remember, important milestones for all the doctors. Please remember, first successful gene therapy, treatment of ADA deficiency scheme. Most common cause of death used to be pneumonia, and children did not used to survive more than 1 year or maximum by 2 years. But nowadays the treatment is possible by synthetic ADA, by gene therapy produced by recombinant DNA technology. There is also some other disorder, PG level question, that is called as APRTS deficiency. APRTS deficiency itself is the name of the disease, called as APRTS deficiency, where we have mental retardation and some other problems and all. Please remember, acid maltase, last enzyme, acid maltase, if this enzyme is deficient, we have some other disorder called as Pompe's disease. Pompe's disease. Actually, in this MCQ, all the 4 options that we are discussing are all life-threatening disorder beta. All life-threatening disorders. Please remember, Lesch-Nyhan syndrome, severe combined immunodeficiency, Pompe's disease. All of you also know Pompe's disease, my dear friends. Pompe's disease. Please try to understand. Yes, non-homologous end joining. कौन है ये? कहाँ से आया? Yes, right answer. Non-homologous end joining, my dear friends, is also the problem associated over there. Please remember, Pompe's disease is the most life-threatening glycogen storage disorder due to the deficiency of acid maltase. Acid maltase. Please remember. Please try to understand. Floppy baby. Floppy baby. क्या बात है? Floppy baby. Pompe's disease. Please remember. Acid maltase. Acid maltase. Please try to understand. All these are important disease. Now coming to Leishman syndrome, like how I always keep these questions every time in the session because it is a very important expected question. Beta, we are talking about two important findings. One is the biting the fingers, nail beds are exposed, nails are missing. Same image that is mentioned in our workbook. Entire lower lip is missing because of continuous biting force. Try to understand. Please remember. Yes, definitely, my dear friends. Please remember, self-confident men get heavy success. This is a question that has been repeated multiple times. Beta, what are the clinical features of Leishman syndrome? In Leishman syndrome, first of all, is this beta self-mutilation. Self-mutilation is one of the hallmark signs that we get to see. Please remember, yes, Pompe's disease, mainly the cause of death is cardiopulmonary failure. It is the hypertrophic obstructive cardiomyopathy, beta, HOCM. HOCM, hypertrophic obstructive cardiomyopathy is mainly seen in case of Pompe's disease. Yes, Rishabh, you are right, beta. Yes. Now self mutilation, confident, my dear friends, we have C से हम लोग याद करेंगे. First of all, choreoathetosis. D, confident. D is dystonia. D, my dear friends, is actually considered as dystonia. कोरियोएथिटोसिस एंड डिस्टोनिया. मेन से हम लोग याद करेंगे. एम से फर्स्ट ऑफ ऑल बेटा मेंटल रिटार्डेशन. ई से प्लीज रिमेंबर दिस इज एक्सट्रीमली हॉस्टाइल मेल चाइल्ड. Extremely hostile male child. And over here we have N for nephrolithiasis. That is the stone at an early age. Leishman syndrome is one of the disorder where we have got stones formation at an early age. G से हम लोग याद करेंगे gout, for which sometimes allopurinol is also going to be prescribed in these patients. H से हम लोग याद करेंगे hyperuricemia. And S say please remember spasticity. There will be also spastic child, not plastic beta. This is called as spasticity or spastic child. Please remember. Please remember. Please remember beta. Thank you so much for your kind words beta. इसको एक बार लिख लेंगे. By chance if you are making notes, anyhow I will share you also this. Self-confident men get heavy success. Self-mutilation. Chorioathetosis is different. Hemibellismus is different. Please try to read about it from physiology. Okay, what is chorioathetosis and what is hemibellismus? कोरियोएथिटोसिस अलग चीज है, हेमिबेलिस्मस अलग चीज है. यहाँ पर इस पेशेंट में कोरियोएथिटोसिस दिख सकता है. द अदर सिंड्रोम दैट आई वाज टॉकिंग अबाउट व्हिच इज ड्यू टू पार्शियल डेफिशिएंसी नोन एज कीली-सिगमुलर syndrome. In this disorder there is less self mutilation, more of chorioathetosis. But in case of Leishman syndrome, there is more self mutilation, less chance of chorioathetosis. D से dystonia. MEN, men से याद करेंगे mental retardation. Extremely hostile male children are sufferer over here. And N से याद करेंगे nephrolithiasis. G से gout. H से hyperuricemia and S से spasticity. Try to remember better. Yes, my dear friends. Orange sands, Milan. Yes, क्या बात है. This nephrolithiasis that we are discussing over here, beta. Please try to understand the stones. These are actually also called as orange sands. Orange sands in baby's diaper. Orange sands in baby's diaper. Yes, beta. Orange sands, beta. Important point. इसको थोड़ा सा ध्यान देना पड़ेगा हमें. Orange sands in baby's diaper is also associated in this. Please remember. That's the reason. In this particular question, my dear friends, we have talked about pain in the lower limb. This might be associated with a case of gout. and reduced urinary output secondary to stone formation. That's why the urine output also decreased in these patients. So it is not eventual कि in one particular patient you will be able to find all the symptoms. ऐसा बोल के कुछ नहीं होता है. There is nothing called as ideal patient, but at least 3 of the findings are positive over here. Self mutilation, there is gout, and there is also nephrolithiasis due to which there is stone formation. इसको एक बार देख लीजिएगा. Coming to the next important motivation बेटा, please remember, धीरे धीरे आप लोग पढ़ाई कर रहे हो. I know all of you are putting your best possible effort. Finally, you are going to climb through these letters multiple time, my dear friends. And on the 26th of July, my dear friends, I strongly believe that all of us are going to pass this exam, beta. May everyone, each and every one of you pass, beta. You will be able to do it, beta. You might be wondering, okay, it is taking a toll on me. 19 subjects. How will we revise? We have just some 5 weeks pending, my dear friend. Just about 5 weeks are pending. How do we do it? My dear friends, you will be able to do it. Just keep immense faith in your mind and keep immense faith in the Almighty. And my dear friends, you guys will be able to pass with flying color. Just wait and watch, beta. This success, this final step you are going to climb whenever you are hitting that exam on 26th of July. Believe me, beta, you will be able to do it, beta. You will be able to do it. ये होगा, इसी बार होगा, इसी बार ये एकदम झंडा गाड़ के आएंगे बेटा. इसी बार होगा. You can do it. You will do it, my dear friends. यही होगा 26 जुलाई जब हम लोग एग्जाम को फेस करेंगे. And once the results are out, there will be smile. You are now watching my smile. You will be watching your smiles and the parents' smile whenever the results are out and you have passed with flying colors. And in your mark sheet, we have those 4-letter words, my dear friends, PASS. These are the things that we want. From the entire team of NEXT, we are wholeheartedly praying for each and every one of you that you will be able to pass. My dear friends, next question. Yes. आराम से इस क्वेश्चन देखते हैं बेटा. अब की बार 200 पार. क्या बात है. दैट शुड बी द एटीट्यूड बेटा. अब की बार 200 पार. आंसर. कौन सा क्वेश्चन है ये. कौन सा क्वेश्चन है ये. बाप रे. अरे बाप रे. नो, नॉट विल्सन. नॉट विल्सन. थोड़ा सा ध्यान देंगे बेटा. यस, yes, yes, I will wait for those calls once you are passing, beta. Yes, my dear friends, yes, right answer, right answer, right answer. क्या बात है. Right answer. Yes, होगा होगा होगा, जरूर होगा. Yes, you will be able to do it, my dear friends. No confusion. देखो, here they have been talking about 12-year-old child, excessive curly hair. This is Menkes kinky hair syndrome. Menkes kinky disease. People also call it as MKD or MKHS. Menkes kinky hair syndrome. Kinky hairs, excessive curly hair, my dear friends. Workup revealed due to a collagen cross-linking defect due to the deficiency of the copper. And we all know, in case of copper deficiency, that is due to mainly ATP7A gene mutation. Yes, ATP7A gene mutation. There will be failure of copper binding ATPase. There will be failure of copper binding ATPase in your intestine. This enzyme is actually present in our intestine, which is mainly acting as a copper transporter. So in this disorder, due to this copper transporter defect, there is a copper deficiency, and due to copper deficiency, collagen's tertiary structure will not be able to go for quaternary structure better. कोलाजेन का जो टर्शियरी स्ट्रक्चर होता है, वहां से क्वाटर्नरी स्ट्रक्चर ऑफ कोलाजेन तक जाने के लिए यू रिक्वायर द इन्वॉल्वमेंट ऑफ एन एंजाइम दैट इज कॉल्ड एज लाइसाइल ऑक्सीडेज. प्लीज रिमेंबर, इन दिस डिसऑर्डर, what is the name of the enzyme that will be taking a hit? This is the lysyl oxidase enzyme. Will not be able to work properly because lysyl oxidase enzymes, my dear friends, it is dependent on copper. Copper is the active cofactor over there. So in case of copper deficiency, my dear friends, lysyl oxidase will not work, and tropocollagen to collagen fibril conversion will be halted, and that's the reason, my dear friends, Up to tropocollagen, collagen will be formed, but after that, only the quaternary structure will not be able to be formed over here. So copper transporter is defective over here, ATP7A gene mutation. Just for your knowledge, all of you know. What about the first one? Collagen 1A1. Yes, all of you know the disorder is osteogenesis imperfecta. Collagen 1A3. 1A3. This is also osteogenesis imperfecta. 1A3, please remember, it is also osteogenesis imperfecta. Beta, osteogenesis imperfecta is mainly reported due to 4 different gene mutation: collagen 1A1, 1A2, 1A3, 1A4. If this digit 1 is coming before, that means we have to talk about the type of collagen, then the subtype 1A1, 1A2, 1A3, 1A4. All these four are collagen 1 type mutation, and all of them they can lead to osteogenesis imperfecta. But if it becomes 3A1 or 5A1, then it will be Ehlers-Danlos syndrome. Try to remember, my dear friends. If it is collagen 3A1 or 5A1 gene mutation, then we have problem with Ehlers-Danlos syndrome. Try to remember this. And all of you know, beta, you don't need my help to teach you this, beta. ATP7B gene, all of us know this is actually for Wilson disease. ATP7B gene mutation, where copper binding and copper transporting ATPase, my dear friends. Wilson disease, all of you know those sunflower type of cataract that we have discussed, KF ring, caseous precious ring. We also have mood swings in male, dysarthria. We have talked about that. How do you approach these cases? All of you try to remember those trientine hydrochloride or D-penicillamine that we have discussed as a copper chelator, and lifelong therapy of zinc has to be given, but together we should not use the penicillamine and zinc. That also we have discussed, my dear friends. Best way to diagnose: liver biopsy, gold standard, but in normal cases we try to go for urinary copper estimation, as well as we can go for serum ceruloplasmin level. That those are the points from Wilson disease that we have also discussed better, right? Important point इसको थोड़ा सा देख लीजिएगा, right? यस, ओके, आगे बढ़ते हैं बेटा जी, आगे बढ़ते हैं. ओके, क्वेश्चन नंबर 7. नेक्स्ट क्वेश्चन में आते हैं. यस, मुझे सिर्फ बायोकेमिस्ट्री ही आता है और कुछ नहीं आता बेटा. Okay, no, we will try to focus only on our subject. Thank you so much for your kind words, but I know only this. In my whole life I have done only this. Okay, yes, wing bat tremor. Yes, Shravani, yes, wing bat tremor. Yes, yes, my dear friends. Question, yes, this is the repeat question beta जो हमारे एग्जाम में आया हुआ है. Try to focus on this beta जी. I hope all of you are able to get the hang of this beta जी. 14-month-old child, OPD, extreme sensitivity to sunlight, photosensitivity, extreme photosensitivity, and there is also freckling in the sun exposed area wherever it was uncovered. If the child is not wearing fully covered clothes, please remember, then there is also sun exposed areas. There is also dryness in the skin and changes in the skin color due to pigmentation. This child was thoroughly worked up. Diagnostic case of xeroderma pigmentosum XP xeroderma pigmentosum, that may lead to skin cancer, because in xeroderma pigmentosum, my dear friends, the most important word that we get to see, it is called as photocarcinogenicity. Photocarcinogenicity is the most important word over here बेटा. इस word को मरते दम तक भूलना मत. There is something called as photocarcinogenicity. Please remember, photocarcinogenicity. Whenever there is an exposure to sunlight, there is a more damage by the ultraviolet rays, due to which there will be skin cancer predisposition. Photocarcinogenicity is one of the important point that we have to remember better. And please remember, this xeroderma pigmentosum, it is due to a defect of something called as nucleotide excision repair. The answer, all of you are right, my dear friends. All of you are right. You did not make any mistake in this question. Thank you so much for that. This is NER. इसी को सब लोग ब्रैकेट में लिखते हैं NER, and this is the actually most common type of DNA repair beta. In our human body, total 6 types of DNA repairs are possible that we will discuss in the next slide. I will also teach you that. बट मोस्ट कॉमन ओवरऑल सबसे ज्यादा जो डीएनए रिपेयर बॉडी के अंदर होता है दैट इज कॉल्ड एज NER, न्यूक्लियोटाइड एक्सिशन रिपेयर. एंड इफ दिस इज नॉट वर्किंग फॉर यू, द डीएनए विल बी गेटिंग डैमेज्ड easily by ultraviolet rays, but it will not be able to rectify those mistakes. That's the reason the patients are now predisposed to skin cancer mostly, right? Many other options are there. We need to target this topic of DNA repair better. DNA repair, please remember DNA. We will spend some time over here because nowadays this sort of questions which are associated in molecular biology is also being asked in our exam better. Please remember, total there are 6 types of DNA repairs. Their names you are seeing 1, 2, 3, 4, 5, 6. The fifth one, it is also having 2 subtypes. Please remember, nucleotide excision repair defect. We have something called as xeroderma pigmentosum and also another disorder called as trichothiodystrophy. Trichothiodystrophy. In short, it is also called as TTD. Some of your friends also had talked about this in the chat section. There is second one, another important over here, that is called as mismatch repair, MMR. Mismatch repair, that is strand directed mismatch repair. And if there is a defect of mismatch repair, my dear friends, we have a disorder called as HNPCC. What is HNPCC? Called as hereditary non-polyposis colonic cancer. This is also called as Lynch syndrome. Lynch syndrome also is of 2 types, Lynch 1 and Lynch 2. Both of them are related to mismatch repair defect. Base excision repair. Base excision repair, we call it as Muthi associated polyposis. There is multiple polyposis over here. It is not the familial adenomatous one, but it is Muthi. As Muthi is a gene associated polyposis. There is a gene mutation over here, beta. Muthi, MUTYH, Muthi associated polyposis. Coming to DSBs. What is DSB? DSB is important. DSB, double stranded break, इसको लोग बोलते हैं DSB. If there is a DSB repair defect, it might be of 2 types. One is called as HR, that is homologous recombination. Another one is NHEJ. What is NHEJ? Non-homologous end joining. Please remember, we are not going in detail, but at least try to make up that what are the diseases due to which type of DNA repair defects. Homologous recombination defect leads to something called as Bloom syndrome, and Bloom syndrome was also asked in your FMG exam recently. Bloom syndrome, there is something called as Werner syndrome. That is also called as RTS. What is RTS? Rothmund-Thomson syndrome. And BRCA1 and BRCA2 associated breast cancers. And Neuro-Behcet's disease called as NBS, Neuro-Behcet syndrome. The list goes on. Homologous recombination defect leads to multiple disorders. At least remember syndrome and Neuro-Behcet syndrome is possible. Non-homologous end joining, my dear friends, there is sensitivity to ionizing radiation, loss of lymphocytes, and also we have something called as ATM. ATM is important, but I am highlighting over here ATM, that is ataxia telangiectasia, and the gene that is responsible over here, it is called as ATM gene, ataxia telangiectasia mutated gene. That is the full name of ATM gene, and that is defective in case of our non-homologous end joining. And we might have also something called as Fanconi's anemia. Fanconi's anemia. Please try to understand Fanconi. And the last one in the list is called as transcription coupled repair, or sometimes people call it as transcription coupled NER. They might use only the word as transcription coupled repair, like how I have put it in the option, transcription coupled repair. ये repair का मतलब ही है, this is a special type of nucleotide excision repair. Nucleotide excision repair might be done beforehand, or it might be delayed a bit, where the transcription starts and then you try to correct the mistakes. See, these are DNA repairs na. DNA repairs must be done after replication process. If you have not corrected the mistake immediately after replication, and if it has gone into the stage of transcription, then also we can do the mistakes correction. That is called as a delayed type of NER, which is now done during transcription process. That's why it is called as ट्रांसक्रिप्शन कपल्ड NER, एंड इसका डिफेक्ट से होता है एक सिंड्रोम दैट इज कॉल्ड एज बेटा कोकेन सिंड्रोम. This is called as Cockayne syndrome. Try to remember this point, beta. Cockayne syndrome, we should remember. Important point, try to focus on this, beta. At least try to remember these disorders, beta. Mainly MMR defect. It is hereditary non-polyposis colonic cancer. Nucleotide excision repair defect. Xeroderma pigmentosum. Bloom syndrome. Homologous recombination. Cockayne syndrome, transcription coupled repair. These four names has been asked in your exam multiple times, beta. इन चारों को भूलना ना. XP, HNPCC, Bloom syndrome, and Cockayne syndrome. At least try to remember these four for your upcoming FMG exam as well. Now, many students are actually getting confused between how to approach these two similar type of disorders, that is Bloom syndrome and Xeroderma pigmentosum. The reason I am spending some extra time over here, because I don't want you guys to miss one mark. Please remember, usually DNA repair defects MCQs are asked commonly in your exam. Bloom syndrome and Xeroderma pigmentosum. In Bloom syndrome, my dear friends, please try to understand there is phototoxicity. Phototoxicity. Hello. Phototoxicity is seen. But in case of Xeroderma pigmentosum, I wrote a word that is called as photocarcinogenicity. Oh. This is the important point over here, beta. Bloom syndrome questions might be also overlapping like Xeroderma pigmentosum. बट इसमें होता है फोटोकार्सिनोजेनिसिटी, उसमें बेसिकली होता है बेटा जी फोटोटॉक्सिसिटी, not photocarcinogenicity. This is the most important line over here between Bloom and XP. Try to keep it in mind, beta. This is important. Now, small clusters of enlarged blood vessels may appear in the rash as well as in the eyes. Enlarged blood vessels cluster, it looks like a tuft. Other symptoms include the patches of skin, which is also common like Xeroderma pigmentosum. Please remember that may be lighter or darker depending on the skin around them. And this is a term that is called as poikiloderma. Poikiloderma can be also seen in case of Xeroderma pigmentosum. What is poikiloderma? Please remember, patches of skin that may be lighter or darker around the skin. That means the skin color is mismatching at a certain position. It might be more dark or it might be more light as compared to the surrounding region. Please remember, small jaw, large ears. Important, beta. In recently asked question, they have mentioned about this small jaw, large ear. Small jaw, large ear. Please remember, small jaw, large ear. Small jaw, large ear. High pitched voice. Yes, important. ये important है बेटा. High pitched voice in case of Bloom syndrome. Fertile problem, learning problems might be there, but these two are important. That's why I'm putting a star mark on this region, beta. Please remember, small jaw, large ear, high pitched voice with phototoxicity. Think about Bloom syndrome, my dear friends, if it is due to a DNA repair defects. Please remember, increased rate of developing cancer at an early age, mainly lymphoma, leukemia or GIT cancer, but never skin cancer. Please try to remember, my dear friends, never स्किन कैंसर. ब्लूम सिंड्रोम के पेशेंट में लाइफ में कभी भी स्किन कैंसर नहीं होता है स्किन कैंसर, बट एक्सपी में स्किन कैंसर होता है. दिस इज द गोल्ड स्टैंडर्ड डिफरेंशिएटिंग फीचर बिटवीन ब्लूम सिंड्रोम एंड Xeroderma pigmentosum, my dear friend. इसमें other type of cancers might be related, GIT related. Please remember, gastrinomas are also noted in this patient. Gastrinomas are also noted in these patients. Leukemias can be seen. Lymphomas, non-Hodgkin type of lymphomas might be seen in case of Bloom syndrome as well. But never skin cancer. Try to understand. Important point. Xeroderma pigmentosum. Please try to understand, my dear friends. Please studying sunburns, dry, xerosis, freckling, lentigos before the age of 2. Patches of increased and decreased poikiloderma can be seen. Please remember, eye sensitivity to bright light. Photophobia is mainly associated with XP. फोटोफोबिया उतना ब्लूम सिंड्रोम में नहीं होता है, यहाँ पर फोटोफोबिया है, फोटोकार्सिनोजेनिसिटी है. आई सरफेस कैंसर, स्किन एजिंग. दिस आर द पॉइंट. प्लीज रिमेंबर, फोटोकार्सिनोजेनिसिटी वर्सेस फोटोटॉक्सिसिटी, डिफरेंट फीचर्स उधर याद करना है. स्मॉल जॉ, लार्ज ईयर्स, हाई पिच्ड वॉइस. if you look at this 8-year or 10-year-old boys, they will be having high tones, high pitch in their voice. आगे बढ़ते हैं, important point. Question number 8. Question number 8. Please remember, question number 8. Easy question है. Question looks big, but it is a chocolate question. It is an easy question. ये easy है, ये easy है. दिखता बड़ा है, but है तो easy. Yes, my dear friends, all of you are thinking in the right line. Yes, 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 yes. क्या बात है? Yes, you are right, my dear friends. Yes, the answer of this particular question, it is option number C. This option number C, my dear friends, please try to understand. Important point to be noted. This is called as 5-HIAA in short. 5 here. 5 high or 5 here, 5 hydroxyindoleacetic acid. What is this question, beta? Please try to focus on the most important word. 12-year-old boy, almost at the age of ending of pediatric age, recurrent cramping, abdominal pain for last 3 months. At this age, recurrent cramping, abdominal pain might be for multiple reasons. The cramping discomfort was episodic, lasting from 10 to 15 minutes, usually primarily to the lower abdomen, characteristic after meal. मतलब खाना खाने के बाद, after meals, that child is experiencing some pain. X-ray showed narrowing of the mid-jejunum, and on exploratory laparotomy, then further on mesenteric biopsy that was taken, it ruled out to be a case of Argentophenoma, but it is malignant Argentophenoma. In this type of cases, the diagnosis basically goes for malignant carcinoid syndrome. Basically, it is a case of carcinoids, and carcinoids are known, my dear friends, to, yes, carcinoids are known to actually cause also pain associated after meal. Post meal pain, my dear friends, carcinoids. Small bowel resection had to be done, no other options better, because that might go for further metastasis to some other regions. Which of the following urinary marker is most likely to be used in the monitoring process during the post-operative period? Once the surgical resection of that part of portion of our intestine is done, then we have to go for thorough evaluation by checking this parameter multiple times, that is called as 5-hydroxyindoleacetic acid beta. This is a question that we have discussed in our tryptophan metabolism in our biochemistry workbook. In tryptophan metabolism, we have talked about those Argentophenoma cases where we have talked about overproduction of serotonin. आप लोगों को याद होगा, overproduction of serotonin. And point to be noted, quickly talking about this, in this tryptophan metabolism, 5-HT, then serotonin that we have talked about, and this serotonin, my dear friends, will be further broken down in the liver by something called as 5-HIAA, 5-hydroxyindoleacetic acid. Serotonin might be taken up outside the liver to go to brain, where in the pineal gland it can go for production of one more guy called as melatonin. That is a different pathway possible in our pineal gland, but mainly it is metabolized by one more guy inside our liver, that is called as the name of the enzyme as MAO. What is MAO beta? Monoamine oxidase. This is the enzyme that can degrade serotonin. But what is the problem in case of Argentophenoma? In Argentophenoma, this tryptophan metabolism pathway, which normally should be only 1% of the tryptophan, that is now channelized to almost 60% of the tryptophan entering into this pathway. Normally, the tryptophan that we eat, because it is an essential amino acid, is going to the liver. It is only 1% that is supposed to go for serotonin synthesis. But in this patient of Argentophenoma, due to some chemical locha, genetic changes, what is going on? 60% of the tryptophan is channelized into this pathway. That's why in these patients there will be chappad phad ke rise of the level of serotonin beta. Serotonin production, my dear friends, will be sky high, and that's why there will be overproduction of this parameter known as 5-hydroxyindoleacetic acid. And my dear friends, we have discussed that this is usually the gold standard marker that we have talked about. Gold standard marker, my dear friends, for diagnosis of this. Please try to understand. In these cases, the other pathways will take a hit. pellagra like symptoms also will be associated over here beta, because that other minor 3% pathway that was supposed to go for B3 synthesis will also take a hit. अगर एक दूसरा minor pathway ज्यादा हो जाता है तो the other conventional minor pathway will also take a hit. Minor pathways only will take a hit over here. One minor pathway is excess, other minor pathway will be decreased. That's the reason in these patients we are also supposed to see B3 deficiency, and it can lead to pellagra like symptoms as well. Point to be noted beta, during the classes at MIST we have also talked about that this enzyme MAO is also present in our lungs. आपको याद होगा 60% in liver, 40% in lungs. And this child, if it is not treated on time, if the surgical resection would not have been done, अगर आपने वो पोर्शन को काट के बाहर नहीं फेंका, then what will happen, this excess MAO that will be present in the lungs will also try to degrade the serotonin. And whenever the excess serotonin travels from liver to lungs, it will also pass through the right chambers of the heart, due to which we have discussed that these patients are also prone for right-sided heart failure due to a complication that is known as tricuspid valve stenosis. Please remember, surgery is the only option in these patients if it has gone to the stage of malignant carcinoid syndrome, because otherwise the patient will lose their life due to right-sided heart failure because of a word that is called as tricuspid valve stenosis. And please remember, patients of malignant carcinoid syndrome are also prone for tricuspid valve stenosis, for which they can also lead to right-sided heart failure. Right-sided heart failure बेटा, important point, try to understand this better. Right-sided heart failure, इसको थोड़ा सा हम लोग देख लेंगे. दिस इज एन इंपॉर्टेंट एंजाइम बेटा जी. यहाँ पर हम लोग तीसरा वाला जो एंजाइम था माओ, उसके बारे में बात कर रहे हैं, मोनो अमाइन ऑक्सीडेस. But please remember, these patients, although in this particular question they have not mentioned about any cardiac involvements as of now, because the resection has been done. If the resection is not done on time, it might lead to other problems as well. Figlu we have talked about in case of B9 deficiency. 3,4 dihydroxyphenylalanine, that is dopa, no need to focus on that. That is for the catecholamine synthesis. This last guy is going to be for catecholamine synthesis. 5-HIAA is a metabolite of serotonin. Please remember, most common site of this argentophenoma we have talked about the mnemonic called as ERA, ileum rectum appendix. Diagnosis may you will be also able to see there is a rise of serum serotonin. Urinary 5-HIAA, my dear friends, will be also increased. That is supposed to be the gold standard. However, we have got some other three minor tumor markers, neuroendocrine markers, because it is a neuroendocrine tumor. One is chromogranin A, neuron specific enolase, and synaptophysin. These names we have heard during the classes beta, but I told you mainly in India we prefer, this is the most common one. Mainly we prefer this one as the urinary 5-HIAA, and whenever it is crossing more than 500 milligram per day, then we should strongly raise the suspicion of diagnosis toward malignant carcinoid syndrome. Yes, pulmonary artery hypertension can be also noted in these patients beta due to right-sided heart failure, and right ventricular failure can be also leading to this, because the filling of the ventricles will not be proper because of stenosis of the tricuspid valve. Filling of the ventricles will not be proper. You are right beta ji, try to remember. Clinical symptoms में हम लोगों ने पढ़ा था, as it is a GIT restricted tumor, mostly these are mainly present with intermittent diarrhea. हम लोगों ने intermittent diarrhea सुना था, and there is also chronic flush that is associated with almost more than two-thirds of the patients. More than two-thirds of the patients you can present with flush. There is also excessive sweating. Excessive sweating को हम लोगों ने क्लास में लिखा था. These patients also complain of something called as diaphoresis. There is also something called as diaphoresis. Fluctuating hypertension will be seen in these patients, and yes, all of you are right beta that you had never forgotten this. There is something called as pellagra-like symptoms. Pellagra-like symptoms can be also associated over here beta. Pellagra-like symptoms, इसको एक बार देख लेना. Important point, malignant carcinoid syndrome. Question number 9. Question number 9. Answer. क्वेश्चन नंबर 9 बेटा, आराम से देखिए, आंसर कीजिए. यस, अभी ठीक करके देता हूँ, आंसर पहले बोलो। Yes, my dear friends. Right. Right answer, my dear friends. Right answer. Right answer. Right answer. Yes. Maple syrup urine disease is the diagnosis over here. क्या बात है, छा गए गुरु, छा गए, क्या बात है। ये क्वेश्चन सही कर दिया, मतलब यू गाइज आर इन द राइट ट्रैक एंड इट विल हैपन बेटा। क्या बात है। 4-month-old child, pediatric OPD, refusal to suck breast milk. I only taught you that whenever there is a word of refusal to suck breast milk, normally, conventionally, we should try to think about something called as galactosemia. एंड मेनली द क्लासिकल टाइप, आपको याद होगा हम लोगों ने बात किया था क्लासिकल टाइप के बारे में। क्लासिकल गैलेक्टोसीमिया वी मेनली गो टू सी दिस वर्ड, बट यहां पर तो क्लासिकल गैलेक्टोसीमिया ऑप्शन में है ही नहीं। ये कैसा बाउंसर हो गया। प्लीज रिमेंबर, along with that, occasional seizures, secondary hypoglycemia. Please remember, it is a form of organic aciduria with normal ammonia level. How to approach this question? Those of you who have made it correct, you guys are great. But for everyone, let me just quickly give you how to approach this sort of question. देखो, galactosemia is ruled out because it is not there in the option. Even if it is mentioned, point to be noted, कैसे ध्यान देना है, in galactosemia children, you never ever go to see something called as beta seizures. सीजर्स कभी भी नहीं होता। मान लो इस ऑप्शन में मैंने ऑप्शन ई डाल दिया गैलेक्टोसीमिया क्लासिकल टाइप, यू माइट रश फॉर दैट ऑप्शन, बट डू नॉट मार्क दैट बिकॉज seizures are never seen in case of galactosemia. There might be E. coli sepsis. In case of galactosemia, my dear friends, there might be something called as E. coli sepsis. There might be septicemia as a problem. There might be unconjugated bilirubin rise in case of classical galactosemia. But this sort of things are not mentioned over here. And point to be noted, there is also secondary hypoglycemia. Now, what is maple syrup urine disease? We all know maple syrup urine disease, which is the answer of this question over here. This is due to the defect in branched chain amino acid metabolism. BCAA metabolism is actually taking a hit, and the three amino acids are valine, isoleucine, and leucine. Out of that, leucine, my dear friends, it is 100% ketogenic. Try to understand this point बेटा। leucine जो है, मैं यहाँ पर कुछ extra point लिखना चाहूंगा so that we try to approach this question. Leucine, my dear friends, it is actually 100% ketogenic in nature. Leucine is 100% ketogenic in nature. Valine, my dear friends, is actually 100% glucogenic in nature. And isoleucine, my dear friends, it is actually 50% gluco and 50% ketogenic in nature. This is the first information that we have to recall from the classes that we have studied. Leucine is the only guy which is capable of going for only ketone body production. Valine mainly goes for glucogenic, because आपको याद होगा हम लोगों ने एक निमोनिक पढ़ा था, the word successful vim. Valine, isoleucine, methionine goes for also succinyl CoA, from where it will go for succinate, fumarate, malate, oxaloacetate, and then gluconeogenesis. So valine goes for basically glucose, and isoleucine can go for both gluconeogenesis as well as ketogenesis. Now, what happens in case of this metabolism? These three metabolism, my dear friends, are not being done properly. So ketone body production will be taking a hit, as well as glucose production is also going to take a hit. That's the reason whenever, my dear friends, we have talked about that successful vim in V, in that mnemonic successful vim, आपको याद होगा, we have talked about that mnemonic called as successful vim, and the word successful stands for mainly succinyl CoA, V stands for valine, I stands for isoleucine. As their metabolism is defective over here, in the Krebs cycle there will be a problem of less anaplerosis. In the Krebs cycle, succinyl CoA regeneration will be defective, due to which ultimately there will be less chance of oxaloacetate production, and there will be less chance of gluconeogenesis. Please try to understand, if these three amino acids are not being metabolized properly, then there is a less chance of gluconeogenesis as well. That's why in their defect, in maple syrup urine disease, there is also chance of hypoglycemia, as it is due to some other metabolic defect. People have used the word over here as beta secondary hypoglycemia. Answers को मगब मत करो बेटा, try to understand the point. Why it is called as secondary hypoglycemia? Because in this case, some other metabolic defect, it is leading to carbohydrate less hypoglycemia. BCAA metabolism, if it is not done properly, the patient might also present with hypoglycemia. So please remember beta, seizures, refusal to suck breast milk, secondary hypoglycemia, this is the classical triad in case of maple syrup urine disease. In our classes we have talked about diagnosis purpose, but we did not touch that main clinical features. Please remember, this is one such disorder, my dear friends, one such disorder. In case of maple syrup urine disease, I would like to add few more extra important word better. There are four types. There are four types. Maple syrup urine disease के चार types होते हैं. One is called as classical. इसमें भी word है classical. Then we have something called as intermittent. Then we have something called as intermediate. And we also have the fourth one, that is thiamine responsive. Please try to make a quick note in case you are making बेटा. मैपल सिरप यूरिन डिजीज के टोटल चार टाइप्स होते हैं बेटा, क्लासिकल, इंटरमीडिएट, इंटरमीडिएट एंड थायमिन रेस्पॉन्सिव. बिकॉज ऑल ऑफ अस नो दिस branch chain keto acid dehydrogenase complex. We all know this is due to BCKDH deficiency. And this BCKDH, my dear friends, it is made by a combo of 351. आपको याद होगा 3 enzymes, 5 coenzymes and 1 cofactor. One of the most important coenzyme for this sort of reaction, which is actually a type of oxidative decarboxylation. It is primarily dependent on the vitamin B1 beta. And in case of maple syrup urine disease, there is a variety where it is only the thiamine deficiency causing this disease, and it is responsive to thiamine. So total 4 forms. Our job is to focus only on the most fatal form over here, that is the classical one beta. And the classical one, my dear friends, is actually the most fatal one as well. And in case of this most fatal type of maple syrup urine disease, we have also clinical features. Please remember, that appears classically in the first week of life. Classical type appears in the first week of life. आपको याद होगा हम लोगों ने जब गैलेक्टोसीमिया बात किया था, माय डियर फ्रेंड्स, ट्राई टू अंडरस्टैंड. Whenever we have talked about galactosemia, the classical galactosemia also mainly appears on day 3, day 4 after birth, within the first week of life. Remember, in the first week of life, whenever we have refusal to suck breastfeeding or refusal to suck breast milk, we try to think about mainly classical galactosemia. Today we are learning, we might think this disorder also as classical maple syrup urine disease. This is the most fatal variety, classical maple syrup urine disease. It presents quite early in the first week of life. And in this first week of life, my dear friends, all of you know, in these cases there is something called as beta burnt sugar smell in the urine. Burnt sugar smell in the urine beta. यहाँ पर there is also chance of beta organic aciduria. There is occasional seizures, refusal to suck breast milk, as well as, my dear friends, secondary hypoglycemia. The features that we have seen in the previous question over here beta, this is actually a case of classical maple syrup urine disease. I will not touch the other 3, but as in your FMG exam question, they have now gone and asking on classical galactosemia, classical type mainly. They might ask a question on classical maple syrup urine disease as well. So try to remember, this disorder can present also with refusal to suck breast milk, as well as it will present in the first week of life. At least इतना ध्यान दो. Intermediate, intermediate, those are milder variety that comes late after 6 months. उसका फीचर अलग है. सारा कुछ हम लोग नहीं पढ़ सकते. We have to be smart enough to focus on the most fatal one, at least classical maple syrup urine disease. And in Indian cases, Indian patients, classical type is also the most common type. That's why I try to focus over here. Point to be noted, propionic acidemia can also present with some ketone body rise. Urea cycle enzyme defect is actually not possible over here, because in this case they are telling normal ammonia. Look at this word beta, normal ammonia. ध्यान दो normal ammonia. As normal ammonia is mentioned, straight away urea cycle enzyme defect is ruled out, because all we know, in case of urea cycle enzyme defects there will be hyperammonemia. Point to be noted, what is multiple carboxylase deficiency? In multiple carboxylase deficiency, we basically have features of maple syrup urine disease plus skin manifestations. I know I am writing something extra that we did not discuss during the classes, but we should know this, that there is another differential diagnosis that is also possible at this same time frame, that is called as multiple carboxylase deficiency, where मैपल सिरप यूरिन डिजीज के फीचर्स तो होंगे, साथ में स्किन इन्वॉल्वमेंट ऑल्सो विल बी देयर, लाइक डर्माटाइटिस और सम रैशेस. If skin involvements are mentioned in this question, same question, skin involvement, child present also with some diarrhea or some rashes, diagnosis will change from maple syrup urine disease to multiple carboxylase deficiency. Try to understand. This question is the only one that is tough over here, and we should remember this. Those of you who have got this one correct, thank you so much. Try to understand better. Multiple carboxylase deficiency, there is rash, alopecia due to biotin deficiency. Yes, one bouncer question यहाँ पर ये चीज था, इसको थोड़ा सा हम लोग देख लेंगे. राइट, इंपॉर्टेंट पॉइंट, प्लीज मेक ए नोट ऑफ दिस. मैपल सिरप यूरिन डिजीज के ओनली क्लासिकल टाइप को हम लोग थोड़ा सा यहाँ पर याद कर लेंगे. ऑल ऑफ यू नो, in this case of classical type, the diagnosis, my dear friends, is done by DNPH test, dinitrophenyl hydrogen test. DNPH test, dinitrophenyl hydrogen test, by which we basically detect something called as branched chain ketonuria. We detect something called as branched chain ketonuria. Branch chain ketonuria is detected by dinitrophenyl hydrogen test. Try to remember this. Right. Question number 10. This is easy. Try to focus on this beta, important point, quickly. Answer. Answer of this question beta ji. यस, ओ ओ ओ ओ ओ ओ थोड़ा सा खेल गया यहाँ पर. अरे थोड़ा सा दोबारा पढ़ो, दोबारा पढ़ो, दोबारा पढ़ो. नो बेटा, नो बेटा, मेनी ऑफ यू आर मेकिंग ए मिस्टेक इन दिस क्वेश्चन. देखो, हम लोगों ने क्या सीखा है बायोकेमिस्ट्री में, हम लोगों ने क्या सीखा बायोकेमिस्ट्री में, हम लोगों ने एक ही चीज सीखा कि जब कभी भी हमें डाउट होता है, whenever we have doubt, my dear friends, that we are not able to solve the question, the safest answer, my dear friends, is to mark the answer as D, and the right answer of this question, it is D. Please try to understand, my dear friends. Here the answer is D. कोई बात नहीं, ऐसे बाउंसर्स आ जाते हैं. someone was asking for some bouncer, this is the bouncer, this is D. D is the answer. हमने इतना सीखा. नाउ क्वेश्चन आपने ध्यान से नहीं पढ़ा, बिकॉज वाई यू आर मेकिंग ए मिस्टेक बेटा. क्वेश्चन वाज एक्सेप्ट. हेलो, एक्सेप्ट था, एक्सेप्ट. इस वर्ड को देखो, एक्सेप्ट. सी व्हाट इज दिस क्वेश्चन? बेसिकली इट इज अ क्वेश्चन ऑन लाइपोट्रोफिक फैक्टर्स बेटा. 40-year-old male CEO leading a sedentary lifestyle, dyspepsia, okay, occasional epigastric pain, stage 2 fatty liver. All of the following beneficial for preventing fatty liver, except. That means they are asking for a group of substances which are called as beta lipotrophic factors. Lipotrophic factors beta. Except आपने except miss कर दिया. I know. That's why we want you to make you familiarize with this word so that you don't make it on the exam day. यहाँ पर mistake करो, mistakes are allowed. No problem beta. We are all friends over here. But exam day में गलती नहीं होना चाहिए. Lipotrophic factors, and in the list of the lipotrophic factors means we have studied that these guys basically they take TAG away from the liver. They take the TAG away from the liver. That means whenever the liver starts depositing your triglycerides inside the hepatocytes, that will be prevented by these good guys known as lipotrophic factors. They remove the TAG away from the liver. And in this list, we have heard mainly we have got the important list: choline, betaine, vitamin E, my dear friends, antioxidant, and vitamin E and selenium. These are synergistic to each other. Please remember one more additional info beta. Vitamin E and selenium, they are the best friends to each other. In case of vitamin E deficiency, you can give selenium therapy. In case of selenium deficiency, you can also give vitamin E therapy. Like that. They are synergistic to each other. They are their best friends. We also have talked about methionine, serine, glycine. Methionine, my dear friends, active form is called as SAM. We have talked about three important B6, B9, B12. I also told you to remember one more guy that is known as the B5. Ionositol, we have touched lecithin, that is phosphatidylcholine, and we have also discussed essential fatty acid and polyunsaturated fatty acid. These are the guys which are considered or talked as lipotrophic factors. But lipotrophic factors that remove the TAG away from the liver. The boss in this was choline. Choline was the boss. Betaine was trimethylglycine, which is also used in the treatment of homocystinuria. Beta choline को हम लोग याद कर लेंगे. Important point to be noted. Choline. And in this list, the only one guy that is missing over here is arginine. Only one guy is arginine is not there in the list. Arginine is not there, right? Please remember. Okay, आगे बढ़ते हैं. Okay, after 5 questions, some motivation, my dear friends. आज क्या करेंगे ना, इसी के ऊपर ही डिपेंड होगा कि भाई फाइनल में क्या रिजल्ट्स निकल के आना है. यू आर ऑन द लास्ट स्टेज ऑफ योर पुटिंग एफर्ट्स बेटा. बस एक मंथ से ज्यादा ही हमारे पास है. इस लास्ट एक महीने में इतना पढ़ाई करो कि एग्जामिनर्स भी डर जाए कि साला इतना नॉलेज लेके आया कहां से है. प्लीज रिमेंबर, this is the last effort that you need to put it in the pedal beta to get the medal once the results are actually going to be out beta. Yes, impossible is, there is no word. Impossible means actually I am possible. Everybody knows this, my dear friends. And please keep your positive attitude in your mind so that once the results are out, there is big smiles. And we want those big smiles in your face once the results are out. Wholeheartedly praying for each and every one of you that it will be possible once the results are out. Question number 11. क्वेश्चन नंबर 11. ये क्वेश्चन अगर किसी ने गलत किया, सच में जहां कहीं भी हो एड्रेस लेके वहां पर जाके पेल देंगे. सीरियसली यार, ये क्वेश्चन गलत होना ही नहीं चाहिए. कैमरे के अंदर घुस के मारेंगे. ये क्वेश्चन गलत होना ही नहीं चाहिए. Yes, 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 my dear friends, you all are right. My dear friends, you all are right. The diagnosis of this case cannot go wrong, and it is a case of beta von Geer's disease, most common glycogen storage disorder seen in Indian children. Overall also most common. Infant presence to OPD, joint pains especially around the knee, bulge out abdomen, thin extremities, recent increased appetite, fasting hypoglycemia, clinical examination, hepatomegaly, pot belly. Hepatomegaly, my dear friends, it is the classical pot belly that we have talked about. Xanthoma over buttocks, most common site, buttock xanthoma, doll like faces. How can you go wrong? Doll like faces, DLF, doll like faces, my dear. Chubby cheeks, classical appearance, hallmark sign, doll like faces. अरे hallmark बोल के रखा है. This is the hallmark sign, my dear friends, that we have to remember for all the patients of von Geer disease. We all know this is due to the defect of the glucose 6-phosphatase deficiency, due to which two pathways last enzyme will be taking a hit. One is liver glycogenolysis, another one is gluconeogenesis, due to which glucose level will not be maintained by the liver. It is a problem only in the liver, due to which the child will present with fasting type of hypoglycemia, and that's the reason there is an increased appetite shown over here beta. भूख जल्दी लगेगा because the glycogen that is stored in your liver is not able to maintain the blood sugar level. Increased appetite. Please remember, these patients infant bola hai na, that means it is presenting maybe after 6 months. After 6 months we have talked about, after 6 months, more than 6 months time, you can also go and see there is a chance of gout. This is one of the very important disorder in India where a 1 year old child can also present with gout. Bulged out abdomen, my dear friend, this is due to hepatomegaly. Sometimes the umbilicus might be inverted over here due to the pot belly type of appearance. Remember, beta, von Gierk disease is the most common GSD in India. Corey-Forbes disease, we have heard about the mnemonic called as ABCD. Anderson, there is a deficiency of the branching enzyme. Cody's disease, there is a deficiency of the D-branching enzyme. And we have just now talked about the most fatal over here in our discussion today. Pompey's disease is the most fatal over here, right? Please try to understand. Deficiency of glucose 6 phosphatase. विनोद थोड़ा सा करेक्ट कर लेंगे हम लोग अपने आप को. ग्लूकोज 6 फॉस्फेट नहीं है बेटा, ग्लूकोज 6 फॉस्फाटेज है. ग्लूकोज 6 फॉस्फाटेज, ग्लूकोज 6 फॉस्फाटेज डिफिशियंसी, राइट. इंपॉर्टेंट पॉइंट, इसको थोड़ा सा देख लेना. ग्लूकोज 6 फॉस्फाटेज, यस. लैक्टिक एसिडोसिस, कीटोसिस, hyperuricemia leading to gout. We basically go for diagnosis. अगर किसी ने diagnosis हम लोगों को बोला, we will go for बेटा ABG analysis. And in ABG analysis, most of the time we get to see the picture of something called as बेटा hagma. हम लोगों ने ये सब चीज पढ़ा हुआ है, इसको एक बार देख लेना. Von Gierk disease definitely is an expected question, my dear friends, in any FMG exam बेटा. ABG analysis hagma, ये कैसे होता है हम लोगों ने बात किया हुआ है. Try to remember, these are the images. Pot belly, classical pot belly image beta. Look at the span of the liver, pot belly appearance, as well as look at the classical image based question, that is for the doll like faces. Doll like faces. Try to remember this beta. आगे बढ़ते हैं. Let us do the question number 12. No, we don't see cardiac involvements much in case of von Gierk disease beta. Yes, PRPP synthetase activity might be increased. Phosphoribosyl pyrophosphate. Right answer. Right answer. All of you are right. All of you are right. Yes, all of you are right. After von Gierk, same topic, glycogen storage disorder. Now it is the most common in adult. Yes, my dear friends, the answer, all of you are right. It is McArdle disease. That is the most common GSD. Most common GSD in adults in India. And I told you, this sort of acute attacks of McArdle disease, it is mainly common in case of females than in male, and that's why please try to understand. 19-year-old complaining muscle aches. She, it's a she. It's a she, my dear friends. It's not an he. It's a she. Important question. She को ध्यान देंगे यहाँ पर. Female gender recently began an exercise program to lose 6 to 8 kg that she had gained in last couple of past year. After the first day of weightlifting, however, she became extremely sore. पूरा का पूरा energy चला गया. Weight lift करते गया, deadlift, bench press, energy is suddenly dropped. Severe hour later, her urine sample was finding something called as cherry soda pop. हर झाग लाइफ में अच्छा नहीं होता. ट्राई टू अंडरस्टैंड माय डियर फ्रेंड्स. चेरी सोडा पॉप. फिजिकल एग्जामिनेशन अनरिमार्केबल. लैब shows elevated levels of creatine kinase level, because in the patients of McArdle disease we have also talked about CK3 or CKMM level will be increased in the plasma. Plasma creatine kinase level will be also increased, because we all know whenever we are performing heavy exercise up to first 1 minute, the energy comes from creatine phosphate. Second backup, it is our muscle glycogen after 1 minute. As in this case, it is a defect of the muscle glycogen phosphorylase enzyme. That's why muscle glycogen can't break down. That's the reason, as the second backup is not working, the first backup, my dear friends, has to work for longer time. Please remember here, creatine phosphate that is stored in your muscle has to overfunction for some more extra time because the second backup muscle glycogen is not working. We all know McArdle's disease, it is due to the deficiency of muscle glycogen phosphorylase. All of us know this is the deficiency of muscle glycogen phosphorylase. And this glycogen phosphorylase, my dear friends, is the rate limiting enzyme of glycogenolysis pathway. So the second backup is not working. That's the reason the first backup is working for longer time. And please remember the third backup in this case, there will be also myoglobin release. And whenever this myoglobin is mobilized, it can lead to something called as myoglobinuria. And due to this myoglobinuria, we are expected to see this word, my dear friend, that is called as cherry soda pop. Cherry soda pop word that we are discussing over here, beta ji. This is secondary to myoglobinuria. Important point, try to understand better. Please try to remember. Wrong runners, not same as the sprinters. Burgundy color urine, cola color urine. This is one of the very important disorder where we also expected to see better the classical cola color urine. CCU, cola color urine. Elevated serum creatinine levels will be there. Mutation in the PYGM gene, glycogen mutated gene. Yes, important points, try to remember बेटा इसको एक बार देख लीजिएगा. Very very PYQs important. B6 and enzyme replacement therapy might be also planned over here. Basically इसमें ज़्यादा कुछ नहीं करना है. For the treatment purpose you have to tell that lady to go for higher amount of creatine supplementation before the gym, and she has to go for slowly performing the gym. मतलब जिम में जाते ही वेट लिफ्टिंग नहीं करना है. Sometimes these patients are actually advised to do cardio for some time, then they can go for powerlifting later on better. So actually mainly the treatment is if they can remove the weights, heavy weight lifting might be avoided and the job will be done. Essential pentosuria also has been asked as a question in your exam better. All of us know in this disorder L-xylulose will be coming in the urine better. That is due to xylulose reductase or xylulose dehydrogenase. Alport syndrome, all of you know, collagen type 4 defect. We have talked about can't see, can't pee, as well as can't hear properly, those stories. Hematuria, there is also sensory neural hearing loss and anterior lenticonus. Cystinuria, my dear friends, we get to see something called as beta cola urine, not cola color urine. This is called as cola urine. This question we have also seen during our subject wise test. This is called as beta cola urine. Cola urine अलग चीज है, cola color urine different. CCU is cola color urine. Cola urine, there are four guys which are coming out together: cysteine, ornithine, lysine, and arginine. Cysteine, ornithine, lysine, arginine. These four, my dear friends, coming together. This is also called as dibasic amino acid urea due to the release of lysine and arginine together, known as lysine arginine coming out in urine, dibasic amino acid urea. इस क्वेश्चन को एक बार देख लेना. Right. Coming to question number 13. Question number 13 बेटा. Expected question topic. I hope all of you get this. Yes, no doubt, my dear friends, in this question the answer will be what? Answer will be what? My dear friends, answer will be B. Yes, B. Multiple myeloma. Yes, M. Multiple myeloma is the right answer. Please try to look for the classical multiple myeloma, my dear friends. We all know the famous mnemonic that is called as CRAB. What is the mnemonic for CRAB? C से हम लोग याद करेंगे hypercalcemia, R से renal stones due to which decreased urinary output, A से anemia, normocytic, normochromic, and B से lytic bone pain or bone lesions, my dear friends. 46-year-old male, low back pain, okay, back pain is there, painful urination, okay, renal stones due to his decreased output, that's why there is renal colic. Please try to understand. Painful urination, नॉर्मोसाइटिक नॉर्मोक्रोमिक एनीमिया एंड हाइपरकैल्सीमिया. ये क्वेश्चन पहले ही लाइन में चीख चीख के बोल रहा है, दिस इज द क्लासिकल अपीयरेंस ऑफ क्रैब्स मल्टीपल माइलोमा, माय डियर फ्रेंड्स. How do you do? We have talked about there is something called as BJP, Benz-Jones proteinuria will be also seen in these patients better. Benz-Jones proteinuria. BJPs were coming out in Mutra Visarjan, Benz-Jones proteinuria, kappa lambda chains will be elevated and those will be coming, light chains are coming out in urine, and this light chain acid metaproteins are mainly positive for Bradshaw test. However, once you perform the heat test is coming negative. I told you, whenever you have a confusion by the urinary test, you should go for double checking by the gold standard. And the gold standard over here for diagnosis of multiple myeloma is beta serum protein electrophoresis. Isko bhulna mat. This is the gold standard diagnostic technique for ruling out multiple myeloma beta. Please try to understand. गोल्ड स्टैंडर्ड बेस्ट, कश्मीर टू कन्याकुमारी कहीं भी जाओ, मल्टीपल माइलोमा का आपको श्योर शॉट डायग्नोसिस के लिए सीरम प्रोटीन इलेक्ट्रोफोरेसिस करना ही पड़ेगा, बिकॉज समटाइम्स द यूरिनरी टेस्ट माइट नॉट बी 100% conclusive in nature. They might give you a wrong or false positive or false negative as well. Like in this case, it was showing false negative because the heat test where we are supposed to see Benz-Jones protein at the temperature of 45 degrees Celsius to 58 degrees Celsius, now that is not being possible. But it is actually case of multiple myeloma because serum protein electrophoresis is showing you that there is a peak over here at the gamma. And we all know in patients of multiple myeloma, there is increased level of IgG. Only immunoglobulin type G will be overproduced over here. It is a type of monoclonal, only one type of immunoglobulin is rising over here, and that is able to show you this peak. This peak that we are seeing over here, it is due to the IgG overproduction over here. Normally, albumin is the most abundant plasma protein. Gamma globulins are not much. Normally, this graph is supposed to be like this. Normally, this graph is supposed to be like this. Try to understand. Albumin, alpha 1, alpha 2, beta 1, beta 2, then gamma band is supposed to be like this. Try to understand what is normal. Hello, normal electrophoretic pattern. This is the image of something called as densitometry. This is an image of something called as densitometry. And as per densitometry, we are able to estimate the fractions of our different plasma proteins. Gamma globulins are supposed to be like this. This is the normal band. This is normal. This is normal. Like this much peak only is supposed to be seen. But in case of multiple myeloma, as there is overproduction of one of the immunoglobulin, that's why there is a sharp rise, sharp fall. Sharp rise, sharp fall. It is not persistent like this. The graph is not like this. Not like this. Graph is not like this. Because only one immunoglobulin is rising. That's why there is a sharp rise, sharp fall. Sharp rise, sharp fall. That is only due to immunoglobulin G over here that is overproduced over here in cases of multiple myeloma. Please remember, there is one more variety called as MGUS. What is MGUS? Monoclonal gammopathy of undetermined significance. Monoclonal gammopathy. Sometimes, my dear friends, monoclonal gammopathy means only one type of immunoglobulin will be rising, but here we do not have the associated problem. It is an undetermined significance because here you do not see the M band in serum protein electrophoresis. We have talked about that in densitometry it looks like a peak. This is the guy that is called as M spike. Yes, all of you are right, my dear friends. ये जो spike like pattern आप लोग यहाँ पर देख रहे हो, this is called as M spike. M spike. But in serum protein electrophoresis, this is actually also called as beta M band. Point to be noted, my dear friends, sometimes Bradshaw test can come positive, heat test for urine for BJPs might be positive, but those are not multiple myeloma because in those cases M band or the M spike might not be seen. That disorder is actually called as monoclonal gammopathy of undetermined significance. Take home point, how to difference between multiple myeloma and MGUS. It is by the presence of M spike or M band. Important point, try to remember this better. Kappa lambda chains are overproduced over here. I would also like to quickly focus on some of the important electrophoretic pattern for our upcoming FMG exam beta. This is on a glass slide. What is the electrophoresis we are talking about over here, beta? This is called as AGE, agar gel electrophoresis. In agar gel electrophoresis, my dear friends, agar gel electrophoresis, this is the normal pattern from negative to positive. We all know in electrophoresis there is a movement from negative to positive. This is the direction of the movement. This big width वाला band जो आप लोग यहाँ पर देख रहे हो, this band is only for our gamma globulins, my dear friend. Let me zoom in. Gamma globulin bands, all IgG, IgM, IgA, IgD and IgE are supposed to be clustered over here. This band is actually for beta. However, the beta can be also divided into two bands, beta 1, beta 2, beta 2, beta 1, alpha 2, alpha 1 and the albumin. Now, in case of multiple myeloma, you are able to see a surprising thing, that there is an extra additional band, my dear friends, between the gamma and the beta. Sometimes two beta can be clustered over here. Normally in our classes we have talked about total 7 bands in case of multiple myeloma, and normally 5 bands, normally 6 bands in case of agar gel electrophoresis. But here in this image you are seeing that only 5 bands are given. Sometimes the beta can be also divided into two, beta 2, beta 1, like that, like how alpha 2 and alpha 1 are separated. But here this extra additional band, my dear friend, that you are able to go and see over here, this is known as M band between beta and gamma. Sometimes they also write it as beta 2 and gamma. If they ask more in detail, they might ask you on beta 2 and gamma over here, beta. इस चीज को एक बार देख लीजिएगा. Point to be noted, for chronic infection, there is a broad-based increase in the gamma region. Try to correlate over here. There is a broad-based increase of the gamma region and general increase on the alpha 1 and alpha 2. Just an important old question, but we should not forget this last pattern over here, beta. I'm putting a star mark over this last pattern. This is important because it is seen in case of something known as nephrotic syndrome, which is very, very common in India. And in nephrotic syndrome, my dear friends, what do you see? Look at the color of the albumin band over here. All of us know in case of nephrotic syndrome, there is a huge loss of albumin. Albumin bands are supposed to be darker like this. But in this case of nephrotic syndrome, the albumin's band on the serum protein electrophoresis has got too much lighter type of band over here. This is actually a warning sign for nephrotic syndrome, hypoalbuminuria. And please try to look at the width of the alpha 1 and alpha 2. This is alpha 1, this is alpha 2. If you just look over here, which one is wider? Alpha 2 is wider than the alpha 1. These two things, if it is mentioned in your FMG exam in a glass slide image, then please choose the answer as nephrotic syndrome. Not talking about nephritic, that is different. This is nephrotic syndrome where albumin will be lost in urine, and alpha 2 there will be compensatory rise, prominent alpha 2 band in serum protein electrophoresis with lighter albumin band. It is a short diagnosis of nephrotic syndrome, my dear friends. Important point. Try to remember this point better. Important. इस चीज को थोड़ा सा हम लोग ध्यान देंगे, इसको याद करेंगे. आगे बढ़ते हैं. Next question. This is easy. Some easy questions. आराम से देखो, हड़बड़ी नहीं करना है. आराम से take a deep breath. Multiple myeloma we have discussed. If that question comes, we will make it right. Next question now. What is this question? What is? अरे ये question तो easy है, chocolate question है. Please try to understand, my dear friends. Answer. My dear friends, this is the thing I'm actually worried for all of you. Silly mistakes. मैं इसी चीज से डरता हूं. आप लोगों से दिल खोल के मैं प्यार करता हूं, बट आप लोगों का एक ही चीज से मुझे नफरत है, वो है सिली मिस्टेक. आपने क्वेश्चन को ध्यान से पढ़ा ही नहीं. You have not seen the question right. Now the right answers are coming. Question is most unlikely. देखो. Zoom करूंगा, कितना करूंगा, ये देखो, इतना कर दिया. Unlikely. It is like all of the following except type of question. Most unlikely. Silly mistakes. silly mistakes is the only thing that you can make you fail बेटा. Silly mistake हम लोग नहीं करेंगे. We will be able to solve all the questions if we read it properly बेटा. Don't jump the gun. Question है इसमें कौन सा चीज के बारे में बात कर रहे हैं? Alzheimer's disease, 54 years old. Alzheimer's. In Alzheimer's, we have seen there is hyperphosphorylated tau, एपोप्रोटीन E4. हम लोगों ने बात किया था ना कि ये जो 4 है, 4 को उल्टा घुमा दो तो बन जाता है Alzheimer's. We have discussed about this Alzheimer's. And also you know my dear friends, beta amyloid precursor protein, which is also called as beta ap, which is also called as beta amyloid precursor protein. These three things are positive in case of Alzheimer's. Question is unlikely. Answer my dear friends over here is lipoprotein small a. This is the answer over here, D beta. This is the answer, lipoprotein small a. And all of us know this lipoprotein small a, it is also known as that little rascal. This is also known as little rascal. हम लोगों ने पढ़ा था that this lipoprotein small a, it is actually a type of competitive inhibitor of plasminogen. It is a competitive inhibitor of the plasminogen beta, plasminogen, where it will not allow the plasmin production, that will it will prevent the in vivo fibrinolysis. Please remember, it stops in vivo. In vivo means within the body. Fibrinolysis, in vivo fibrinolysis, that means once the clots are formed, clots are not dissolved easily. There will be throughout in our bloodstream there is a chance of thrombosis and embolism, due to which it is actually prone for heart attack in the patients, because it can lead to atherosclerosis. Lipoprotein small a, we have discussed my dear friends, it is highly atherogenic in nature. This is highly atherogenic, and for some unknown reason, maybe we Indians are carrying some abnormal gene, due to which this lipoprotein small a is found to be raised in more than 40% of the population of India. More than 40% Indians, as we speak, as we are watching this YouTube video, are actually having unusual levels of lipoprotein small a beta. इसको देख ली, highly atherogenic lipoprotein small a, important point. Try to understand this better. Hope this is crystal clear to all of you. The first three is important for Alzheimer's disease, and the last one is actually for atherosclerosis that we have talked under the topic of lipoproteins. 15th number question. Question number 15. Two easy questions back to back. Two easy questions. कोई बात नहीं, सिली मिस्टेक्स यहां पर हो रहा है, होने दो, कोई प्रॉब्लम नहीं है, बट एग्जाम से पहले ये आदत हम लोग इससे पीछा छुड़ा लेंगे, ताकि एग्जाम में कोई ऐसा मिस्टेक ना हो. टाउ प्रोटीन देख के लोग उसकी तरफ भाग जाते हैं, एमाइलॉइड देख के भाग जाते हैं, बट क्वेश्चन वो नहीं था, क्वेश्चन था अनलाइकली. यस, क्वेश्चन ओवर हियर. यस माय डियर फ्रेंड्स, इसमें तो एकदम सही जवाब, छा गए गुरु, छा गए, छा गए. यस, the answer over here my dear friends is Creutzfeldt-Jakob disease. Yes, all of you know that this is the most common prion disease noted in humans. We all know Creutzfeldt-Jakob disease is the most common one seen in the Indians. We also have talked about fatal familial insomnia. We have talked about GSSD, Gerstmann-Straussler-Scheinker's disease, एंड हम लोगों ने पढ़ा था वो आघोरी बाबास के बारे में, जिनमें हम लोगों ने बात किया था कुरू डिजीज के बारे में. प्लीज रिमेंबर this CDEF, these four my dear friends are actually prion disease. However, Alzheimer's, Parkinson's, they are not prion disease. That is also a question that has been asked in your exam. Please remember, in case of mild form of Creutzfeldt-Jakob, please remember Creutzfeldt-Jakob disease actually are of two types, mild and severe. In mild forms, my dear friends, you are seeing these changes like personality changes, anxiety, depression, memory loss, and slow bodily movements. But in case of severe forms, we have discussed that this disorder actually can also kill you if you have eaten too much of that infected mutton, because the most common carrier of the Creutzfeldt-Jakob disease to human, it is sheep. मोस्ट कॉमन कैरियर इज शीप. तो मटन अगर अच्छे से पका के खाते हैं तो कोई दिक्कत नहीं होना चाहिए, बट इफ यू नीड or eat an infected mutton, it can also lead to death. So important point, Creutzfeldt-Jakob disease, important form of the prion disease that we have to remember better. Alzheimer's, Parkinson's are also due to misfolded proteins. Like in Alzheimer's, we have three misfolded proteins like hyperphosphorylated tau, apoprotein E4, beta amyloid precursor protein. But in case of this, it is not prion, Alzheimer's and Parkinson's. The other four are prion: CJD, FFI, GSSD, and Kuro. Try to remember this point. Try to understand sheep. Basically, we have to incinerate the body, otherwise it can lead to mass disasters later on, because it can cross the species barrier. हम लोगों ने ये चीज पढ़ा था. My dear friends, आपका पास पूरा का पूरा आपके हाथ में ही है. It is you who has to put the effort, my dear friends. We can only counsel, we can only motivate you, but at the end of the day, it is you who has to wake up on time, who has to make your study plan, and you will be able to revise all the three questions. My dear friends, I sincerely request all of you better, in the time that we have in our hand, please do attend all the YouTube live sessions for 25 most important clearly contained questions for all the upcoming subjects, and try to also revise on that day for that particular subject, so that you are keeping in touch with almost all the subjects better. You will be able to do it. I have got immense belief in all of you, and it will happen, my dear friends. Question number 16. क्वेश्चन नंबर 6, लास्ट 10 क्वेश्चंस, लास्ट 10 क्वेश्चन, जल्दी से इसको निपटाएंगे बेटा. ओके, इंपॉर्टेंट क्वेश्चंस बेटा, जल्दी से सोचो. आंसर 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 आंसर. Some of the answers came as C. Some of the answers, my dear friends, you guys are right. Now you better always right. The answer of this question, my dear friend, is osteogenesis imperfecta. Osteogenesis imperfecta. OI. Please remember, history of frequent fractures. You should not go wrong with this, beta. In the right thigh region, lower limb, no active management is required. चीख चीख के बोला था कि ये these are self-healing fractures. Please try to understand. In case of these are usually self-healing fractures. Self-healing fractures, but that we get to see. And usually there is also blue color sclera. Self-healing fractures. Brittle bone disease. हम लोगों ने पढ़ा था osteogenesis imperfecta. It is also known as brittle bone disease. Important. And it is the same site, common site from where multiple time fractures are there, but no K-wire, no nail, no cast, no spleen, no open reduction, internal fixation, nothing is required, because these are self-healing type of fractures. Blue color sclera. Please remember, apart from that, in some of the forms of osteogenesis imperfecta, we also have two more extra information: barrel shaped chest and triangular shaped face. Please remember, these are the two extra clinical features that we are discussing during this session. बैरल शेप्ड चेस्ट, ये बात हम लोगों ने नहीं किया था पहले, एंड ट्रायंगुलर शेप्ड फेस can be a feature of also osteogenesis imperfecta. Better try to understand. Ehlers-Danlos syndrome, we have no flexible skin, stretchable skin, flexible joints, all those things. Homocystinuria, there is a more chance of atherosclerosis at an early age. Marfan syndrome, all of you know the entire mnemonic of Marfan syndrome is Marfan. So those features are totally not matching over here. It is a case of osteogenesis imperfecta, beta, self-healing type of fractures, brittle bone disease. Please try to look at these extra images that is not mentioned in your workbook, beta. I will be Mr. India for a while so that you guys can see this image. Please try to look at this face over here, triangular shaped face. You are trying to able to try to understand over here the crease over here, triangular shaped face that we are trying to appreciate over here, beta. Triangular shaped face, try to remember, and barrel shaped chest. Barrel shaped chest. This is actually one of the things that you understand. ये pigeon chest नहीं है बेटा. Pigeon chest doesn't look like this. Exactly looks like a barrel. देखो पूरा का पूरा एकदम जो oil के barrel होते हैं, barrel shaped chest looks exactly like barrel. So these two images, try to add it to your arsenal of osteogenesis imperfecta, beta G. Please try to remember this Coming to question number 17. आंसर गलती नहीं करना है. Yes, 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 you are right. Yes, you are right. The answer of this question, my dear friend, is classical galactosemia. Why? What are the positive findings? What are the positive findings? देखो यहां पर भी है lethargy after breast milk, refusal to suck breastfeeding. Okay, refusal word है galactosemia सोचना है, vomits during force feeding, accepting glucose water. But this sort of things might be seen with von Gierk disease. This sort of things might be seen. The first two red lines might be seen with von Gierk's, but yellowish tone, oh, and mucous membrane, jaundice. Please try to understand here. Jaundice is positive. Jaundice positive in classical galactosemia, not in von Gierk's disease. This is how you rule out beta. Please try to understand. Unconjugated hyperbilirubinemia will be seen. UCB rise. UCB rise. Unconjugated bilirubin rises in case of classical galactosemia because that galactose 1-phosphate can inhibit that enzyme UGT, uridine. Please remember UDP glucuronide transferase enzyme, and that's the reason, my dear friend, they can also present with jaundice. Jaundice कभी भी नहीं दिखता है in case of von Gierk disease. Von Gierk disease में jaundice नहीं होता, classical galactosemia में jaundice होगा. Duodenal atresia, it is a topic of surgery that sir will focus on that. I will not barge into his topic better. And please remember, hereditary fructose intolerance, basically it is seen only after 5 to 6 months. This is straight away ruled out because here they have mentioned about only few days after birth. Hereditary fructose intolerance, whatever might be the clinical features, but we have targeted how to approach this sort of questions because we have got hereditary fructose intolerance that is possible only after 5 to 6 months. बेटा 5 to 6 months के पहले ये चीज नहीं आता है, राइट. इंपॉर्टेंट पॉइंट, इसको थोड़ा सा देख लेना, पीछे से कुछ स्पेशल इफेक्ट चल रहा है, इसको छुपा देते हैं. ओके, नाउ ओके फ्रुक्टोज मेटाबॉलिज्म, गूगल पता नहीं, ये जेमिनी ये सब क्या है, एलेक्सा, माय गुडनेस. ओके, आगे बढ़ते हैं. 18th क्वेश्चन. Yes, hereditary fructose intolerance, it is due to the deficiency of aldolase B. Aldolase B. Okay, answer to this question. क्वेश्चन को ना ध्यान से पढ़ के आंसर करना है बेटा. डोंट जंप द गन. Yes, Calliput deficiency, classical galactosemia, all of us know that. Mm. 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 Answer of this question. Hello everyone. What is the answer of this question? I don't know. Please help. Please help. आंसर ऑफ दिस क्वेश्चन. ओह, लोगों को बाउंसर चाहिए था, बाउंसर मिल गया. ओके, आंसर ऑफ दिस क्वेश्चन प्लीज. फर्स्ट ऑफ ऑल डायग्नोसिस बोलो, ऑप्शन छोड़ो, डायग्नोसिस बोलो, ऑप्शन छोड़ो, डायग्नोसिस बोलो. डायग्नोसिस क्या है? Ehlers-Danlos syndrome. Yes, the diagnosis of this patient is EDS, Ehlers-Danlos syndrome. My dear friends, ये बाउंसर था because please remember, we all know in Ehlers-Danlos syndrome most common collagen defect is actually most common collagen defect is type 5. That's why you are choosing all the answer as type 5 collagen. But my dear friends, in this question it is a bouncer and here the answer is type 3 collagen. ओरे बाबा रे बाबा, ये कैसे हो गया? चमत्कार हो गया. Type 3 collagen is the answer of this particular question, because in this question they have talked about CT angiography revealed ruptured abdominal aortic aneurysm. My dear friends, try to understand over here. During the classes at BIST we have discussed in EDS there are total 6 types. I did not teach you all the 6 types. We have Villefranche and Berlin's classification. No need to mark those classification. Just try to focus that in EDS, the most fatal type, EDS most fatal type, it is type 4. Type 4 EDS. And in type 4 EDS, there is defect. In type 4 EDS, there is a defect of type 3 collagen. टाइप 4 ईडीएस में टाइप 3 कोलाजन का डिफेक्टिव है. एंड प्लीज रिमेंबर द निमोनिक, माय डियर फ्रेंड्स, ऑल ऑफ यू नो देयर इज समथिंग कॉल्ड एज स्कैब. व्हाट इज स्कैब? Skin most abundant for type 1, type 2 most abundant cartilage, type 3 most abundant arteries, and type 4 most abundant basement membrane. And please remember, whenever there is a defect of the type 3 collagen, arteries are damaged, and that's the reason in this EDS it is fatal, because the patient might lose their life with ruptured abdominal aortic aneurysm. Aortic aneurysm, my dear friends, is the key over here. Aortic aneurysm हम लोगों ने लिखा था क्लास के दौरान that this is seen only if there is a defect of type 3 collagen which is found in our arteries. Odd numbers are mainly seen in skin. Type 3 is also present in skin, but it is most abundant in the arteries. And if there is a defect of that, then the answer of this will change to type 3 collagen. ये होता है bouncer. Try to understand, my dear friends. Here they are not talking about the classical type. This is vascular type. Please remember, type 4 EDS का ही दूसरा नाम होता है vascular type. And in this vascular type of Ehlers-Danlos syndrome, we actually have defect of the type 3 collagen. 3 का defect के वजह से 4th EDS is seen. Type 3 defect is seen in type 4 EDS. ये चीज हम लोगों ने क्लास में डिस्कस किया था. This is why we have to choose that options rightly, बेटा. ये सब करके आप देखिए, stretchable skin, flexible finger. Yes, it is Ehlers-Danlos syndrome. It should be type 5, but यहाँ पर पेशेंट को aortic aneurysm भी था, जिसके लिए आंसर चेंज होके हो गया this. Point to be noted, बेटा. Joint defect of both type 6 and type 7 collagen, it is seen in case of another disorder that is called as epidermolysis bullosa. Epidermolysis bullosa, where we have talked about mainly blisters formation. Frequent blisters formation will be seen. That is one of the differential diagnosis of vampire's disease. Vampire's disease में भी हमारे पास blisters होते हैं. यहाँ पर भी है epidermolysis bullosa. We are also having this blisters formation common. Type 1 collagen defect, all of us know. One more time, osteogenesis imperfecta. 3 and 5 both are Ehlers-Danlos syndrome. 3 and 5 both are Ehlers-Danlos syndrome. I hope this question अगर आ जाता है तो आप सही करके आओगे. 19th question, जल्दी से. We have to finish the session within 3 hours time. जल्दी से थोड़ा सा स्पीड पिकअप करेंगे. Yes, मेरा आवाज गूंजता रहना चाहिए, और ऑन दैट एग्जाम डे यू शुड नॉट मेक दिस मिस्टेक. ज्यादा एक्साइटमेंट में, बिकॉज कॉमन वर्ड्स विल बी देयर, वी शुड नॉट जंप द गन. पूरा को पढ़ो, टाइम है, पढ़ो. यस यस, ये गलत नहीं होगा. ऑल ऑफ योर राइट बेटा, इसको आप गलत कर ही नहीं सकते हो, तो नींद में भी सही करके आओगे. एंड माय डियर फ्रेंड्स, आंसर इज गोइंग टू बी Alkaptonuria. Yes, Alkaptonuria is the right answer. Alkaptonuria is the right answer. No doubt. 40 year हम लोगों ने पढ़ा था, most common age in case of male. Here the gender is female. Sedentary lifestyle, palmoplantar pigmentation, X-ray spine shows zone of calcification in the intervertebral disc, positive finding. Benedict's sample, Benedict's test is positive, greenish brown. बाप रे बाप, सब कुछ तो हो गया. Greenish brown precipitate. Yes, greenish brown. Please try to understand by looking at this image. You might be wondering it is actually a cola color type of urine, and we have studied that in the patients of Alkaptonuria we can also see this cola color in urine for some time. कोला कलर यूरिन हो सकता है, यहां पर इस इमेज में ध्यान से नहीं दिख रहा है, बट एक्चुअली एट द बॉटम वी आर गोइंग टू सी सम ग्रीनिश ब्राउनिश टाइप ऑफ प्रेसिपिटेट. सो इट विल लुक लाइक ए मिक्सचर ऑफ brown green type of precipitate in case of Benedict test. If you perform Benedict test, you will be able to see in this image it is not seen that much prominent, but at the bottom green, on top will be brownish greenish brownish precipitate will be seen in case of Benedict test. Because हम लोगों ने पढ़ा था that homogenesic acid is actually a type of reducing substance. Reducing substance, my dear friends. Reducing substance. That's why this test is also positive. Remember cola color change. As along with that, ferric chloride test will be also positive. हम लोगों ने और एक चीज पढ़ा था बेटा, FCT. Ferric chloride test is also positive over here. Right. PKU, renal glucosuria. Renal glucosuria can give you positive Benedict test where it will be going up to almost orange or red color. Argininosuccinic aciduria does not lead to cola color urine or does not show this sort of features. All of us have talked about this image-based questions that are quite associated. Intervertebral disc calcification, palmoplantar pigmentation like the shape of a V. We have talked about enterpina turning black in color and cola color urine for some time. We can all see Alkaptonuria. Question number 20 answer. PKU, mousy musty odor in urine. Yes. Answer. Yes. Sahi jawab. Tangiers. Yes. Tangiers disease that was first seen in Morocco. Tangiers disease, because the hallmark sign of Tangiers disease or the earliest warning sign, it is called as beta orange yellow tonsils. Yes, हम लोगों ने पढ़ा था orange yellow tonsils. Orange yellow tonsils is the first warning sign. First warning sign. Orange yellow tonsils beta, it is the first warning sign. First warning sign. Important point. Please remember serum HDL gap. Serum HDL over here, it is somewhere between 0 to 5 mg per dl beta. Normally it should be around 50, but in this patient it can be as low as 5 mg per dl. Patients will not survive for long because the LDL will now take the upper hand. Please remember A beta lipoproteinemia is a different disease. This one, first warning sign, we have talked about steatorrhea. हम लोगों ने पढ़ा था steatorrhea. And please remember we have also talked about in peripheral blood smear, we have talked about acanthocytes where RBCs are able to show some spine-like projections. Please remember important steatorrhea. Orange yellow tonsils, Tangiers disease, it is ATP binding cassette type 1 type of gene mutation, ABCA1 gene. ABCA1, yes. Artsy girl, yes, thank you so much. Yes, ABCA1 gene mutation over there, better. Please try to understand in case of this disorder. Try to understand. Why in Morocco? Because बेटा Tangier is an island that is seen in Morocco. पूरे दुनिया में पहले दफा वहीं पर ही लोगों को, शायद दूसरे जगह पर भी हुआ होगा, बट लोगों को समझ में वहीं पर ही आया, तो जगह का नाम से डिजीज कर दिया Tangiers Island seen in Morocco. Why in Morocco? पता नहीं, ढूंढेंगे मोरक्को जाके ही देखेंगे कि क्यों ऐसा हुआ था. Right, important point, my dear friends. Noram's disease. What is Noram's disease, बेटा? Noram's disease is actually again complete deficiency of LCAT. Remember, partial deficiency of LCAT. Partial deficiency of LCAT, it is actually called as beta fish eye disease. हम लोगों ने पढ़ा था fish eye disease के बारे में in that same page of our Biochemistry workbook. That was fish eye disease, partial deficiency of LCAT. Norum disease is complete deficiency of LCAT. Wolman disease, this is deficiency of, my dear friends, hormone sensitive lipase, cholesterol ester hydrolase और lysosomal acid lipase. हम लोग मिस्ट के लाल जी को कैसे भूल सकते हैं? हम लोगों ने पढ़ा था लाल जी का डेफिशिएंसी को भी बोलते हैं वुलमैन डिजीज. जोक्स अपार्ट, आई होप लाल जी इज नॉट लिसनिंग टू दिस लेक्चर लाइव, नहीं तो मुझे बाद में पड़ेगा. सो हार्मोन सेंसिटिव लाइपेस, कोलेस्टेरॉल एस्टर हाइड्रोलेस और लाइसोसोमल एसिड लाइपेस deficiency leads to Wolman disease. So these are some one-liner question that has been asked sometime. Please try to understand. ये चारों के चारों one-liner थे. All these four has been asked in your exam. All four are one-liner question. Answer to this question is angiostasis. My dear friends, we need to focus. We need to focus. We need to focus only on one goal. Follow only one course until you reach the success. But that is the full form of focus, my dear friends. Many of you already know this. गोल अभी इतना ही है कि किसी तरह हमें 26 जुलाई को पील देना है पूरी तरह. That's why at the last stretch, my dear friends, we need to only focus in the right direction. Do not allow any negative thoughts to creep into your mind. Do not get in touch with any negative individuals who will try to, keep you in a disarray like scenario. You know you are achieving, you are going to achieve, you are achieving that only one goal of FMG exam clearing and getting that formation from foreign medical graduate to an Indian medical graduate. Very soon, my dear friends, it will happen better. Keep your focus, keep trying, keep pushing yourself, and my dear friends, success will be definitely yours whenever the results are out. I strongly believe in each and every one of you कि इस बार ये जरूर होगा. 21 last 5 questions जल्दी से, last 5 questions. नोरा की आंखें फिश आई जैसी. क्या बात है, बाप रे बाप. कुछ और तो नहीं देख रहे हो कि यूट्यूब लाइव ही देख रहे हो? यूट्यूब में कुछ और तो नहीं ढूंढ रहे हो ना? माय डियर फ्रेंड्स, फोकस. यस, आंसर 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 माया. ट्राई टू अंडरस्टैंड. इसमें थोड़ा सा गड़बड़ हो गया बेटा. ट्राई टू फोकस ओवर हियर. दिस इज एन इमेज ऑफ व्हाट? दिस इज एन इमेज ऑफ बेटा नकल xanthoma. व्हाट इज दिस? दिस इज आवर नकल xanthoma. This is knuckle xanthoma, and these knuckle xanthomas we have discussed in type 2A hyperlipoproteinemia. Type 2A hyperlipoproteinemia, which is also called as primary familial hypercholesterolemia. And please remember, in this one, my dear friends, actually there is a defect of cholesterol rise. बेटा इस क्वेश्चन का आंसर है बेटा कोलेस्टेरॉल, नॉट ट्राइग्लिसराइड, नॉट कोलेस्टेरॉल एस्टर. Here the right answer of this question is beta cholesterol deposition. Knuckle xanthoma, basically it is what type of beta? This is LDL deposition. This is LDL deposition over here beta, and these patients might present with also some hepatosplenomegaly. इसमें बेटा cholesterol is the best answer. Cholesterol best answer. Second is cholesterol ester. Third is triglyceride. If you ask me the causes of knuckle xanthoma, I hope I'm not obstructing the view better. In knuckle xanthoma causes, in this image, knuckle xanthoma, it is mainly due to the cholesterol deposition over here better. इसमें हम लोग A को best answer mark करके आएंगे. Please remember, if you recall, we have also talked about Palmer xanthoma. If it is in the Palmer creases, Palmer creases में जो xanthoma होता है बेटा, that is mainly associated with बेटा triglyceride. Palmer xanthomas are more common, but knuckle xanthomas on this side, on the extensor surface, I told you like this in the class, if it is on this side, my dear friends, type 2A, but if it is on this side, it is type 3. Type 3 mein we have problems with triglyceride. Type 2A we are mainly having problems with beta cholesterol. इसको एक बार देख लेना बेटा. This is an image based question that was also asked earlier in your exam बेटा. इस इमेज को देख लेना. We are trying to focus on these knuckle xanthomas over here and also over the distal interphalangeal joint. Please remember, DIP में भी हो सकता है, but mainly over the knuckle. Important question. Try to understand this better. Question number 22. Question number 22. 22 का आंसर. आंसर. आप लोगों को बाउंसर चाहिए था, मैंने ज्यादा नहीं 2-3 बाउंसर ही डाला है. दिस इज ए बाउंसर. थोड़ा सा ध्यान से दोबारा पढ़ो, दोबारा पढ़ो क्वेश्चन को. यस, नाउ द राइट आंसर्स आर कमिंग. Right answers are coming now. Yes, this is a case of Hartnup's disease. Yes, yes, my dear friends, Hartnup's disease. This is a case of Hartnup, 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 Hartnup. Hartnup's disease is the answer of this question. Please remember, beta, हम लोगों ने पढ़ा था Hartnup disease. What is it? Hartnup disease is a tryptophan transporter defect. Tryptophan transporter defect. Tryptophan transporter defect, where the essential amino acid tryptophan is not able to get absorbed from the GI tract. That's the reason tryptophan will be remain in your lower intestine for longer time. That's the reason whenever tryptophan is acted upon by intestinal bacteria, then those tryptophan will be converted to one extremely foul smelling substances known as indoles and scatols. Indole scatol production, my dear friends, is quite commonly seen. Foul smelling stool is the important point over here, beta. Foul smelling stool. Please remember, episodic diarrhea, foul smelling stool. And please remember, and frequent forgetfulness, because whenever there is a tryptophan deficiency, it can also lead to pellagra. And in pellagra, my dear friends, all of you know there are 4D. One of the D over here, my dear friend, is also known as dementia, dermatitis, diarrhea, dementia. Diarrhea is mentioned. Frequent forgetfulness of the works assigned to him. This line can lead to something known as beta dementia. And please remember, all of you know the famous image over here. This you cannot go wrong, beta ji. This is the Casal's necklace. Dermatitis is the first sign. It is a case of pellagra. But we have discussed in our classes at MIS that there are multiple causes of pellagra. Most common cause of pellagra is B3 deficiency. However, B6 deficiency, Hartnup disease, and carcinoids, all those three can lead to pellagra. And remember, in case of Hartnup disease, for the diagnosis, we have talked about a test called as Obermeyer test, where you collect the mutra of the patient and you see that there is a blue color in urine, light blue color. Here it is darker because it is a severe case, beta. Darker color of urine. This is the case of blue diaper or blue urine syndrome, where please try to understand something called as beta blue color. This is due to the presence of indicanuria. इसी को लोग बोलते हैं बेटा जी indicanuria. So please try to understand, my dear friends, indicanuria. Important point, try to understand over here, beta. Urinary instrumentation rules out indicanuria. So it is a case of pellagra, but it is due to Hartnup's disease. B3 deficiency pellagra, there will not be any indicanuria. There is, in case of B6 deficiency with this feature we have talked about, they can tell you something called as xanthurenic aciduria. हम लोगों ने आज ही पढ़ा था xanthurenic aciduria. If it is mentioned, then the answer will go for B6 deficiency. Or they can also talk about RBC transaminase activity. RBC transaminase activity can be decreased in this case of B6 deficiency. RBC transaminase activity, can be decreased in this patient. or xanthuronic acid can be increased in this patient, then the answer will go for B6 deficiency. B6 deficiency के केस में आपको ये चीज दिख सकता है, xanthuronic aciduria या फिर RBC transaminase के बारे में. And malignant carcinoid syndrome we have also studied today itself beta. In this case with the features of pellagra, we will also talk about 5-HIAA elevation in the urine. So remember different type of questions by using the same image. Even if they don't show the image of indicanuria, but we should keep in mind of our foul smelling stool over there, that is due to the overproduction of indoles and scatols. Indoles and scatols. Please try to understand. Here in this case, the foul smelling stool, it is due to the production of indoles and scatol. Indoxyl, scatoxyl type of compounds will be produced over here in case of Hartnup disease. Hartnup disease, tryptophan transporter defect. I'm not naming the ट्रांसपोर्टर नेम बिकॉज दैट हैज नॉट बीन आस्क्ड एवर इन योर एग्जाम, बट इसको एक बार देख लेना. पेलाग्रा का क्वेश्चन तो है बट द आंसर ओवर हियर इज Hartnup disease. Hartnup disease. You guys wanted bouncer. What is this question answer? थोड़ा सा पढ़ना तो पड़ेगा इस क्वेश्चन को बेटा. आंसर ऑफ दिस क्वेश्चन प्लीज. थोड़ा सा पढ़ो, थोड़ा सा पढ़ो, थोड़ा सा पढ़ो, पढ़ के आंसर करो प्लीज. Now the right answers are coming. Yes. The right answer of this question, my dear friend, is biopterin. Yes, biopterin is the answer. Option number B is the biopterin. It is a case of what? I want diagnosis. What is a case of this? This is which case? All of us know PKU. Which type of PKU? I want answer. Which PKU? Which type of PKU? Classical or non-classical? Classical or non-classical? Which PKU is this? Classical or non-classical? कौन सा PKU के बारे में यहाँ पर बात कर रहे हैं? The right answer is biopterin. We will explain this question. First answer. Please try to understand. PKU, which classical? Classical or non-classical? Classical or non-classical, my dear friends? Yes, try to understand, my dear friends. It is a case of non-classical. Yes, 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 yes. It is a case of non-classical PKU. Prepare for the tough questions. In exam, you will get easy question. But you should know, by chance, if bouncers are asked, how to handle them. See, read the question. इस question को पूरा पढ़ो आराम से. Non-classical है ये. Normal screening of a child of PKU. A male newborn shows serum phenylalanine level 35 mg per dl. We have studied greater than 20 mg per dl is considered as the positive test. So it is a case of PKU. It is a case of PKU. And in PKU, there is no role of B12, B6 or B9. Methylcobalamin is B12, pyridoxal phosphate B6, tetrahydrofolate, it is B9. Even though you have not understood the meaning of the questions, but you should try to rule out, because all of us know in that phenylalanine metabolism pathway that we have talked about, there is no role of any of this, but there is an important coenzyme required, biopterin, and we have studied that biopterin is an important non-vitamin coenzyme. We all know this is actually an important non-vitamin coenzyme that is helping important for tetrahydrobiopterin to dihydrobiopterin by that enzyme dihydrobiopterin reductase. Now, in this case, signs of tyrosine deficiency is also apparent. Obviously, in PKU, tyrosine will be low, phenylalanine will be high. Now, enzymatic analysis of the cultured fibroblast obtained after circumcision shows normal activity of phenylalanine hydroxylase. That means, as it is normal phenylalanine hydroxylase, that means it is not a case of classical beta. In classical PKU, there is a defect of phenylalanine hydroxylase itself. A possible explanation might be it is not due to the enzyme defect, but it is due to coenzyme defect. And in non-classical PKU, we basically have defect of the coenzyme defect. And in this, please try to recall the pathway steps. All of us know phenylalanine normally is converted to tyrosine by that enzyme that is called as phenylalanine hydroxylase. PAH is the name of the enzyme. PAH is the name of the enzyme. This is normal. As per our MCQ, this is normal. But we all know that the active form of the biopterin is called as tetrahydrobiopterin, which should be converted to something known as dihydrobiopterin. And in this, basically, whenever there is a recycling of dihydrobiopterin to tetrahydrobiopterin, during this we require an enzyme called as DHB reductase. हम लोगों ने एक चीज का नाम सुना था, dihydrobiopterin reductase. DHB reductase is the name of the enzyme. And my dear friends, please try to understand over here. Whenever there is a biopterin deficiency, this reduction back to active form will not be possible. So this is a coenzyme defect. Please try to understand, my dear friends. Segawa syndrome is a different type of syndrome over here, beta. हम लोग इसको थोड़ा सा याद कर लेंगे. This is the dihydrobiopterin reductase deficiency, और there is a dietary intake of biopterin. इस पेशेंट का ट्रीटमेंट क्या होगा? नॉन क्लासिकल में हम लोग यहाँ पर फोकस करेंगे ट्रीटमेंट के तौर पे. यू विल फर्स्ट गिव दैट food item that is called as tapioca देना है, and we will also try to give the tablet of biopterin. Problem will be most likely solved by giving this two. One, you are giving high level of tyrosine, low phenylalanine, साथ में हम लोग tablet biopterin देंगे इस पेशेंट को. No role of B6, B9 और B12 over here. It is a non-vitamin coenzyme. biopterin से ये क्वेश्चन था, इसको एक बार देख लीजिएगा. इंपॉर्टेंट क्वेश्चन में पूछा है कोएंजाइम्स के बारे में. दिस इज बायोप्टेरिन. ओके, इसको नॉन क्लासिकल पीके. Okay, last two questions of our session. Last two questions of our sessions. Try to understand. जल्दी से इसको देखते हैं बेटा जी. Important point. Try to focus. Important point, my dear friends. Quickly देख लेते हैं. नॉन क्लासिकल. नो, सेगावा सिंड्रोम ये नहीं है बेटा. सेगावा सिंड्रोम बेसिकली इज प्रॉब्लम एसोसिएटेड विद डोपामिन बेटा. डोपामिन प्लीज रिमेंबर. डोपामिन बाहर से दिया जाता है. दैट इज डोपामिन ट्रीटमेंट फॉर दोज डिस्टोनिया. देयर इज पेशेंट्स ऑफ डिस्टोनिया. Dystonia can be treated by dopamine. Dopamine therapy, when it is given in the treatment of dystonia, then it is called as Segawa syndrome. Here it is talking about biopterin. That is not related over here, beta. Right. Yes. Now the answers of this question, beta. Answers of this question. Yes, my dear friends. Yes. Yes. You are thinking in the right line. All of you are right, beta. You cannot go wrong in this question. Basically, urine for methyl malonyl CoA elevated. आज ही हम लोगों ने शुरू करते हुए पढ़ा था. Methyl malonyl CoA is elevated. This is actually a case of MMA positive. Methyl malonic aciduria is positive over here. MMA, methyl malonic aciduria is positive. And sure shot, what is the most likely vitamin associated? It is going to be a cobalamin, beta. Cobalamin or vitamin B12 over here. Basically, what is the case? All of us know it is a case of homocystinuria. Homocystinuria is the case over here, beta. Please remember, 35 year, quite tall, 6 feet tall, 84 kg, BMI okay, blood pressure okay, no clear to occultation, cardiac impulse okay, then glucose concentration okay, homocysteine level is high. बोला ही हुआ है यहाँ पर, it is a case of homocystinuria. Homocysteine concentration is high. It is around 19.3 micromoles per liter, where the normal is up to 55. Serum lipid concentration within the reference range, urine for methyl malonyl CoA. So it is a deficiency of B12. The patient might be strict vegetarian, due to which there is chance of homocystinuria over here. हम लोगों ने ये homocystinuria pathway पढ़ा था. And in homocystinuria pathway, homocysteine metabolism mainly it is handled by three type of vitamins: B6, B9 and B12. Let us do a quick recap over here, beta. Only focusing on this thing. First of all, we have studied about that this homocysteine is an extremely toxic substance, and it should be either converted towards cysteine, my dear friends, or it can be reconverted back to methionine, my dear friends. There are two ways we can handle this homocysteine guy, which is toxic over here. And point to be noted, my dear friends, this homocysteine guy, whenever it is going to go back to methionine, we need to activate one enzyme that is called as MS. MS enzyme stands as methionine synthase. Methionine synthase. And please remember, this enzyme methionine synthase is dependent on the vitamin B12. And whenever we have actually B12 deficiency cases, methyl malonyl CoA will be also elevated. That is another pathways enzyme. Methyl malonyl CoA mutase enzyme might be non-functional over here due to the lack of vitamin B12 beta. So यहाँ पर ना तो B9 के साथ कोई संबंध है, ना ही हमारे पास B6 के साथ कोई संबंध है, because B6 is actually required in both the two steps of this CBS and CGL enzyme. Most commonly homocystinuria is due to deficiency of the enzyme cystathionine beta synthase. But यहाँ पर हम लोग mainly focus कर रहे हैं on the deficiency of the vitamin B12. In all the cases of B12 deficiency, methyl malonyl CoA basically rises. Try to understand MMC methyl malonyl CoA. So it is answer is D. Please remember, if they say methyl malonyl CoA normal, then you can answer both as pyridoxine as well as folic acid. Is MMA is normal, then both of these will be chosen and both of these answers will be accepted over here better. Please try to understand this, but here it is cobalamin deficiency. Finally we are moving to this almost last homocystinuria में हम लोगों ने और एक चीज देखा था बेटा जी, लेंस डिसलोकेशन. आपको याद होगा, दिस इज एक्चुअली ए डाउनवर्ड डिसलोकेशन ऑफ लेंस. हम लोगों ने पढ़ा था बेटा in Marfan syndrome, upward dislocation, homocystinuria, downward lens dislocation. They look as Marfan but also show other great complications. Please try to refer to that portions from our biochemistry workbook better. They look as Marfan but also show other great complications. Charlie Chaplin gate, fish mouth vertebra, homocystinuria, my dear friends, is an expected question that we should not forget. Finally, last question of our session, last question of the day. Hope all of you get this question and hope all of you get 1 mark from this question beta. Downward dislocation हो गया. Last question, this was expected beta. गोवा का बात तो चल ही रहा था, इस क्वेश्चन को हम लोग जरूर देख लेंगे. Together after passing the exam we will travel to Goa. Goa needs our support and we must travel to Goa. And गोवा के बारे में क्या ही बोले. I hope one mnemonic that you will never forget till you die is the story of Goa, like how we have discussed in our classes. My dear friends, all of us know this is a case of something called as Wernicke-Korsakoff syndrome. And in Wernicke-Korsakoff syndrome, basically we try to take a three-prong approach, three-step process. First, we do C. Second, we do B. Third, my dear friends, we do a CBA. This is the approach that we try to take in the order, because we have discussed during the classes of Wernicke-Korsakoff syndrome. If you do not correct the B1 deficiency first and if you give glucose first, you might kill the patient, because extra glucose converted to pyruvate by glycolysis pathway, if it wants to go to acetyl CoA, it will require B1. But in patients of Wernicke-Korsakoff syndrome, as there is a deficiency of vitamin B1, then first we need to correct the B1 deficiency, then give glucose load. Otherwise, pyruvate produced by the glycolysis can lead to lactic acidosis if it is not able to convert it to acetyl CoA. That's the reason first हमें सबसे पहले B1 deficiency को correct करना पे, and we will try to give a 100 milligram slow IV bolus. हम लोगों ने ये पढ़ा था 100 milligram slow IV push. Further to this, based on the CBG level of the patient, capillary blood glucose level, you can choose 5%, 10% or even up to 20% of the dextrose. Then whatever electrolyte imbalances has been noted in these patients, those has to be corrected. This electrolyte management also has to be done. Hydroxycobalamin has got no role in treatment of Wernicke-Korsakoff syndrome. Injection of hydroxycobalamin we have already studied better. This is important for only cyanide poisoning. This is important for cyanide poisoning beta in Wernicke-Korsakoff syndrome. Please remember, do not forget the carbon monoxide poisoning, cherry red skin that we have talked about, confined space, all those things we have discussed. So with this, my dear friends, नहीं, बिफोर ग्लूकोज नहीं है बेटा, हम लोगों ने क्लास में पढ़ा हुआ था, फर्स्ट वी हैव टू गिव द इंजेक्शन ऑफ थायमिन। इफ यू गिव ग्लूकोज फर्स्ट, ज्यादा कुछ नहीं होगा, पेशेंट आपके आंखों के सामने ही टपक जाएगा। आपने गलती से ग्लूकोज अगर पहले दे दिया इस पेशेंट्स को, पेशेंट गारंटी के साथ टपक जाएगा, उसके बाद लोग आपको सामूहिक तरीके से पेल देंगे। सो ट्राई टू अंडरस्टैंड माय डियर फ्रेंड्स, वेरी इंपॉर्टेंट पॉइंट ओवर हियर, फर्स्ट you have to correct the B1 deficiency, then you have to give the glucose load. Otherwise in these patients, pyruvate will be converted more to lactate, and due to lactic acidosis there will be more precipitation of the CNS symptoms. Global confusion might lead to global catastrophe. Try to understand. We all know the full form of GOA, my dear friends. First global confusion, then ophthalmoplegia, as well as there is chance of ataxia or gait disorder. So first try to correct the B1 deficiency, then you try to give the glucose load, then you try to go for salvaging the electrolytes, right? So wish you all the very very best, my dear friends. From the core of my heart, I am praying for each and every one of you, and I do hope that you get this sort of question, and I am praying for each and every one of you that may every one of you can pass this upcoming FMG exam beta ji। इस बार एकदम करके ही आना है। Doesn't matter from where you have come, doesn't matter from which college you have studied, doesn't matter from which country you have got the MBBS degree, does not matter. These things will not count in long run better. Only thing, once you are passing that exam, we want those 4-letter word in your mark sheet, PASS. Attempts also does not matter. Marks also does not matter. Pass or fail matters, because it is a licensing exam and you need the license to become a practitioner in India. You are just one checkpoint ahead beta. Reach the checkpoint, एकदम चेक पॉइंट को फाड़ते हुए निकलिए, फाड़ते हुए एकदम चेक पॉइंट को तोड़ते हुए निकलिए। एंड माय डियर फ्रेंड्स, praying for all of you sincerely from the core of my heart, from the bottom of my essay node, I am praying for each and every one of you, and please make us proud, please make us proud, please make us proud. Thank you so much for giving me a patient hearing for this last 3 hours of session. Wish you all the very very best, and please do keep in touch with me till the exam, and please let us meet one more time later on the recall session with those smiling faces. Thank you so much, and good night to all of you. Please keep pushing yourself. May everyone, all of you pass. Thank you so much. Thank you so much. Thank you so much.